council colleagues and residents across the country, I especially want to thank my colleagues on the council, sitting on the board as the Board of Health, who have worked so hard on behalf of all of our residents to help address the disparities that existed prior to the pandemic and have been exacerbated since it. Those disparities, frankly, are immoral, and we are collectively completely committed to ensuring that we address them once and for all. And this year, as council president, one of my major areas of focus is to focus on public health and work with our African American health program, all of our public health officials, our community-based organizations, our nonprofit organizations, and our private sector to help make sure we holistically address the needs of our community. In the video today, you will hear from many of the leaders in our community who have been on the front lines addressing this issue every day. And we can't forget that those public officials have just been under siege. We were all heartbroken with the messages that we know Dr. Gales received when he was here working on behalf of all of us. And we know that has been extended in many ways to Dr. Bridgers and Dr. Kroll and all of our public health officials. And we stand united in our fights against hate, which we know still exists today. So we stand committed as a community to come back stronger. And we look forward to the commemoration that we are going to have today to recognize and celebrate the sacrifices and the leadership of so many. In our attendee list today includes, as I said, Dr. Bridgers, Dr. Kroll. We also have Ms. Cherie Branson here, Mr. Greg Wims, Ms. Linda Plummer from the NAACP, Ms. Anita Powell and Ms. Denise Jones, Christopher Barclay, our former member of the Board of Education, Mr. Byron Johns, co-chair of the Black and Brown Coalition. My former colleague and friend, Councilmember Valerie Irvin, is in the audience as well. And so is Reverend Kendra Smith from, and we also have Dr. Sandra Mann, Dr. George Benjamin, Dr. Coots, the president and CEO of Holy Cross Hospital. We have Charlene Day, a registered nurse specializing in maternal and child and health and labor and delivery. We have the Reverend Matthew Watley. We have Lillian Holt, Kimantri Rollins, Ms. Jackie Williams, and Ms. Pat Grant from our African American Health Program. And all of the speakers in the audience are invited guests of my colleagues and I, but there are many more leaders in our community who we know would like to participate in today's commemoration. We will be hearing from some of those distinguished leaders shortly. But with that, I now want to turn it over to my two colleagues on the council who all of us so enjoy working alongside and so appreciate their leadership in so many different ways. First, we will hear from my colleague and friend, Councilmember Will Jawanda, followed by Councilmember Craig Rice. Councilmember Jawanda.
Thank you, Council President, and happy Black History Month to all my colleagues and to everyone gathered here today. It's great this is a great Zoom. I'm normally in speaker view, but I'm in gallery today because I wanted to see all these beautiful faces. It's a great day. You know, this month is a time where we take special time to set aside and to think and to reflect and to honor and to celebrate the achievements, the accomplishments, the struggles, the victories, the setbacks, the whole encompassing life and journey that has been the Black experience here in America. Just around 3 years ago, I brought together, and my colleagues and I, we commemorated 400 years since the first documented enslaved Africans arrived on these shores. And we brought together a beautifully diverse group of African immigrant, West Indian, African American, the whole diaspora, to commemorate that event and to chart a path forward for greater healing and opportunity and equity that we know we're still on for our Black community. We didn't know it then, but it would be one of the last times we would all gather before this pandemic hit. And we have a lot to do, and we have done a lot. So much has come. You heard some of it described by our council president. And so when we have this year's theme of Black health and wellness, it's a two-sided coin. There's the celebratory side, right, of the great medical professionals and achievements that have happened. We have Dr. James McCune Smith, the first Black American to receive a medical degree, Dr. Jean Spurlock, Dr. Charles Drew, Dr. Marilyn Gatson, who lived many years here in Montgomery County, and whose groundbreaking research led to a national sickle cell disease screening program for newborns. That happened right here in Montgomery County at one of our African-American residents. And Dr. Corbett, who works at NIH and who was one of the young African-American women doctors who was leading the research team for the COVID-19 vaccines. We have that story and that celebration. We've been at the forefront of that medical research as African-Americans. The other is the stark reality that was alluded to, that we have massive and unfortunately in some cases growing health disparities that continue to plague the Black and the African-American community. It's one of the reasons that I drafted a resolution my colleagues unanimously supported, declaring racism a public health crisis here in Montgomery County. Last year, 90% of the new HIV infections were of Black women, 90%. We know that Black and Latino residents were getting COVID at higher rates. We're dying 10 years younger. I'm proud of the work this council did to push for the data to make sure we can have a focused and targeted approach in COVID. And we know all the social determinants of health have grown and are very wide, not only nationally, but we have issues here in Montgomery County, whether it be infant mortality, maternal mortality, and the like. So we have work to do. The good news is this team assembled, the people we're highlighting today are on the forefront. This council is committed to it, and we're going to make sure that we work together to address all the legacy and history that has led to these disparate statistics for our African-American community. So today we salute the health professionals in our community who have dedicated their lives to narrowing and eliminating those gaps and promoting wellness in our community. And we never forget the sacrifices that all of our Black residents have made, both here and locally, nationally, to get us where we are today. And we're still on that journey. So happy Black History Month. And I look forward to continuing to work with each and every one of you to make sure that we continue to make progress. Thank you, Mr. President.
Thank you, Councilmember Jawanda, for those powerful words. Councilmember Rice.
Well, thank you very much, Mr. President. And I really want to thank Councilmember Jawanda for those powerful words. It really is true that for far too long, African-American communities have endured the burden of health disparities, as evidenced by this current pandemic. And when we look at this year's Black History Month, it highlights the importance of Black health and wellness, and is a reminder that we can only be a more prepared and resilient nation when all communities are healthy and strong. And so when we have our Black and Brown communities, our communities that are more socioeconomically impacted, that continue to have exacerbated rates when it comes to COVID, when it comes to high blood pressure, hypertension, heart disease, all the things, we know that there's so much work, as you heard from Councilmember Jawanda, needs to be done. So when we talk about this year's Black Health and Wellness theme, it's especially timely because our nation continues to struggle with the impacts of COVID-19, but then also the recovery from COVID-19. We have no idea what the long-lasting impacts will be of people who've actually contracted the disease. And so it will be incredibly important for us to remain vigilant, to understand that those who were affected at a larger rate, those that are in our Black and Brown communities, those that are socioeconomically impacted, continue to have the resources that are necessary to ensure their healthiness and well-being. So this month really serves as an opportunity to reflect not only on physical, but also on mental and emotional health, and how many communities have remained resilient in the face of the healthcare inequities that we see that exist, and how cultural and ancestral traditions have informed our understanding of wellness. We need to seize this opportunity that we have before us to where people are more mindful of their physical, mental, and emotional health. We need to make sure that we utilize these opportunities to where people understand how important it is to break those barriers that have kept so many of us from being successful. A child that walks into school who's mentally or physically unhealthy cannot do as well as a counterpart who is. It's very clear. I'm at the National Association of Counties this week, and I'm here talking about social and emotional learning and mental health, especially when it comes to our school children, something in which we need to do more, working with the Biden administration, working with everyone from our federal partners to our state partners, the local leaders across this country to make sure that folks understand just how important this is. We can truly build back, as the president says, a better nation. But the only way that we can do it is to acknowledge the failures and the challenges that we've made over the previous years. That's the reason why the council supported Councilmember Jawanda's lead when it came to declaring racism a public health emergency. That's on all of us. But we can make a difference, and we have. And I want to close by just lifting up our partners in the county. When it comes to our African American Health Program, when it comes to the NAACP, when it comes to our churches, when it comes to our nonprofit leaders, when it comes to our health leaders in the community, all of you deserve so much praise for what you have done. Standing up programs like the Black Physicians Network, standing up programs like diabetes and heart disease management, standing up infant mortality and making sure that those programs are there to reduce those inequities. All of those things are progress that we have made, many that happened before the COVID pandemic. And we thank you for that. And we know that, as Councilmember Jawanda said, there's still more work to be done. And I look forward to working with you in that capacity over my short time here on the council, but hopefully in many other roles as we continue to foster better health for our Black community. Thank you so much, Mr. President.
Thank you very much, Councilmember Rice. And as a member of the HHS and Education and Culture Committee and chair of the Education and Culture Committee, I know you've been on the front lines addressing those mental health issues, as all of my colleagues have. And I can't thank you both enough. So just a quick run of show. In just a moment, we're going to see an incredible video that was produced by our wonderful Public Information Office team. I especially want to thank Public Information Officer Jordan Lindsay and Audio Visual Production Specialist Joseph Thompson for producing today's video segment and everybody that contributed to it. After the video, we're going to hear from Dr. Kroll and then Dr. Bridgers, and then all of my colleagues will speak as well. And then we are going to hear from several of our distinguished invited guests this afternoon. We will then read the proclamation, my colleagues and I, and we will end with a poem, Still I Rise by Maya Angelou, read by Emily Cumby, an intern in the Office of Vice President Glass, who he will introduce at the very end. So with that, let's see the video.
Ain't gonna let nobody turn me around, oh, turn me around.
Throughout the years, the African American community has evolved and overcome several obstacles. During Black History Month, we celebrate all the achievements, highlight excellence, and look forward to the bright future of African Americans, not only nationwide, but also right here in Montgomery County. This year's theme is Black Health and Wellness, and we're going to start by taking you to church.
We shall overcome. We shall.
Throughout the history of African Americans, the church has always been a cornerstone of the community. So at one time, it was just the safe haven, and I believe that it still continues to be a safe haven. So if you go all the way back to the days of slavery, the church was the one place that African Americans had. That was the one place where you could, safely learn how to read, that you could freely express yourself and not be fearful of someone telling you that you couldn't do that.
Here at Kingdom Fellowship AME Church in Silver Spring, the history runs deep.
Our 4 core values are gather, grow, give, and go, which essentially is we go out into the community and serve everyone.
Today, they continue to serve the community, not only religiously, but through various resources, including health.
In today's time, it's still a safe haven. It's a place where if you need a sense of security, whether it is food security, whether it is housing, whether it is help with employment, you are fleeing from domestic violence, or whether you just are new to the area and you need someone who understands you, the church is that.
We offer a variety and array of resources. It is extremely exciting. So we have, since March of 2020, been offering our emergency food distribution. And we've been hosting those food distributions throughout the East County region. We're also serving in some of the hardest hit apartment communities. We also serve at the elementary schools that are in this area. And so we work directly with the principals and the staff to facilitate the food distributions that we have there. We're also supporting the Montgomery County Coalition for the Homeless. We supply their breakfast bags for their homeless men's shelter. We partnered with African American Health Programs, so they've been here on Wednesdays. In addition to that, we've added on vaccines. So we work very closely with Holy Cross Hospital. They are one of our primary medical partners, and we started that over a year ago. Some of the clinics happen here, but again, with the clinics, we go out into the community and trying to make it easier for people to be able to access some of these services.
Throughout the COVID-19 pandemic, Montgomery County's data dashboard shows that communities with a high percentage of African Americans have been impacted by health disparities, including lack of accessibility, which has been a troubling pattern in U.S. history.
From a historical perspective, W.E.B. Du Bois pointed out the disparities that we've had in the African American community. So this is not new. This is something that has been part of a big legacy of slavery, the inequities, the mistreatment, over the years.
In general, for the African American community, we always talk about the Tuskegee experiments and things that go back as far as slavery and all of the misinformation and disinformation about African American physiology and healthcare. There's a healthy distrust of healthcare in general because we've been marginalized for so long.
COVID-19 did, like many new diseases when they enter the community, it impacted the most vulnerable and those with disparities. And of course, that means communities of color. And also people who had those underlying diseases of heart disease, lung disease, kidney disease. If they got infected, they were much more likely to get a severe case of COVID. And therefore, we saw a disproportionate impact on communities of color.
So there were so many limitations, throughout our history that really marginalized us in many cases. Despite the best efforts of those who were practicing medicine, we got second-class health care because we were seen as second-class citizens.
We continue to not treat everybody equitably in our healthcare system today. Some of it is conscious bias, but a lot of it is unconscious bias. And we have a lot of work to do to make sure that people recognize the disparities and the way they think about treating people in our system.
African Americans are among those often overrepresented in the child welfare and criminal justice systems and experience higher levels of disadvantage on measures of health, education, and economic development. However, the Black community continues to prevail and has come a long way.
We need to make sure that we do the kinds of things that we can to prevent illness in the first place. So getting down the ideal body weight is very important. So exercising, even if you just get up and walking.
Nutritional and fitness awareness is another solution and can ultimately help the Black family structure thrive.
Positive health overall is important for the Black family structure simply because we have some of the highest numbers in terms of chronic disease, which is highly preventable. Some of these diseases are adversely created from the choices that we make, whether it's the foods we eat or the foods we shouldn't be eating, or some of the elements that we consume heavily, just because they were always around us, alcohol, cigarettes, et cetera, et cetera. So our goal is to help break that curse and help our people make life-enhancing decisions. When it comes to nutrition and fitness, we host free events, pop-up events. We host an annual Fit Father's Day celebration downtown Silver Spring, where we see 500 to 600 families come out and do a group workout. We use the resources of the website. We have healthy recipes on there and simple recipes that dads can make themselves instead of taking their kids to fast food. A lot of our information is based on eating more fruits, vegetables, and whole grains. So I feel as though overall health and fitness, changing the mind, how the brain thinks about making decisions, also gives us the willpower to stay on the course to make other positive life-enhancing decisions. So I think if the Black family structure had a little bit more of that as the basis, as the foundation, we wouldn't have as many obstacles and hurdles that we face.
Black families also need healthy moms and babies.
We care for the mind, body, and soul.
According to the African American Health Program, a disproportionately high infant mortality rate exists in the African American population.
Research has shown that there are disparities between the Caucasian population and the African American population in terms of birth outcomes. So our African American babies do poorly in labor, delivery, care. We have more comorbidities like hypertension, diabetes, just more stresses in life.
That's why the organization's maternal and child health focus area seeks to improve the likelihood of good pregnancy outcomes among Black women in Montgomery County.
What we do as a registered nurse, case manager, we call the clients and we eliminate or try our best to eliminate any stresses that they may have. If they have issues with paying their rent, we try to assist them with that. If they have relationship issues, if they have medical problems, if they go to the physician and their physician uses terminology that they're not familiar with, or sometimes they may feel intimidated by the physician, they'll come to us. We'll explain to them what their diagnosis is. We educate them on proper nutrition, the importance of exercise, the importance of taking their medications as ordered by the provider. Our program stresses the importance of education, which we use as prevention from becoming preeclamptic, from becoming hypertensive, from becoming diabetic. So the purpose of our program is prevention first.
And how can some of these health disparities within the Black community be addressed? Leadership and representation of African Americans in healthcare can help lead to a possible solution.
Especially in a diverse community like Montgomery County, people need to see themselves in leadership in order really to even trust healthcare. So I think it's very important to see representation, whether it's minorities in nursing, minorities as physicians, even the front desk staff that welcomes people into the hospital. The more people see themselves, the more comfortable they are with healthcare.
And county leaders are also already working towards a solution, which includes the Racial Equity and Social Justice Act, which was spearheaded by Councilmember Nancy Navarro and enacted by the full council in 2019.
And this passes unanimously. Thank you, everybody.
The legislation was brought forth to serve as an instrument to begin dismantling persistent disparities seen throughout history.
This is an instrument that we can use to equip us to better address these issues, both legislatively and through budgetary decisions and through initiatives, etc.
It is groundbreaking, and so that would apply for all of our folks who we know continue to be challenged with health disparities, and make sure that social justice does have that in definition.
We're taking this step forward in making more of a reality that everyone here in our county, regardless of who they are, can get one step closer to realizing the promise of Montgomery County.
United we win, working and building towards a brighter future.
Well, that was outstanding and extraordinarily well done. Thank you all so much. We will now hear from two of those extraordinary African-American leaders in our community, and then we will hear from my colleagues, and I'll go over the order, colleagues, right after we hear from our next two speakers. But next we will hear from Dr. Raymond Kroll, our Director of the Department of Health and Human Services, followed by Dr. Bridgers. Dr. Kroll.
Good morning, Council President Albornoz, and thank you to Council and for all the guests that are here today. Honored to be here in this morning and in the company of such wonderful people who've made and continue to make racial equity and social justice a priority in Montgomery County. I'm deeply proud of the work that the county has done and the company that we're in today. You know, diabetes, infant mortality, maternal health, high blood pressure, heart disease, jobs, housing, educational opportunities are all places where the Black community, where the disparities show up for the Black community. And it is historically the case, and it remains the case even in as forward-looking a community as Montgomery County. Depression and suicide, limited access to health care, and the decisions that are made within the healthcare system reflect and continue to reflect on and are driven by issues of bias and implicit bias that have been historic and are indeed endemic to the state of America in many cases. And of course, COVID-19 came along and made it abundantly clear, made those disparities abundantly clear for us. You know, a year ago when George Floyd died, I got a new understanding of the phrase that some of my younger clients have used, feeling some kind of way, was their expression. And I was feeling some kind of way about where we were in America and where I was as a Black man in America, angry and frustrated and sad, and hurt and determined at the same time, but at this and driven to try to do more to try to resolve some of these long-standing issues. But at the same time, and over that year, I watched council and I watched the county executive and I watched the community, and I became proud. When I look at Fit Fathers, prouder. I became a fit father, the work of Fit Fathers, the work of the African American Health Program, the Black Physicians Health Network, the equity programs that we put forward in testing and vaccinations efforts and our efforts to make sure that people had what they needed and it was getting to the people who could get there, who couldn't get there easily. That work made me proud. Our way forward is long. We have a long road to go to recover from COVID, and we have a long way to go to continue to drive address the issues of equity in health and in wellness of the Black community. There's a lot of hard work ahead, and there is no crystal stair. This is going to be a long and continuous hard slog, and we have to remain ever vigilant lest we slide back into some old and destructive ways. In this moment, it is fitting and uplifting for me, and I hope for those who are watching, that we take a moment to look back at how far we have come as a society and as a community, and to say thank you to those on whose shoulders we stand, to gather our strength and our resolve to continue to move forward. So I'm happy to be here this morning and want to thank the council for recognizing and for this moment in history for us. Thank you, Council President.
Thank you, Dr. Kroll. So beautiful, so powerful. Dr. Bridgers.
Good morning, Council President Albornoz, Council Vice President Glass, Director Kroll, who echoed many of the my recurrent remarks that you will hear. Council members, and to all those present today for this Black History Month commemoration. Also, thank you for all of the esteemed members joining the Black History Month commemoration and proclamation, for keeping me in touch with the pulse of the community. I have ongoing conversations with many of you, and if you don't know, then you need to ask, and it's okay to ask. I've learned that. Many have indicated, and that was such a powerful presentation that it actually brought tears to my eyes, because I can reflect some of those disparities in healthcare needs in my own personal quest for my own wellness. However, Black health and wellness and healthcare disparities are not a new reality. They've been documented for decades and reflect long-standing structural and systemic inequities. One of the programs, as we saw illustrated and highlighted in the video, is our health African American health program that sits under the Health and Human Services umbrella in the Office of Community Affairs. It has been instrumental as one of our community health partners and continue to provide services that include outreach, health education, support groups, and as again illustrated, nurse case management. But I also want to highlight one of the chronic illnesses that is at the forefront of our health equity framework and our community health needs assessment. It's also important to mention the growing cancer disparities with Blacks in Montgomery County. Blacks in Montgomery County continue to experience a disproportionate burden of cancer incident and mortality. For this reason, Public Health Service continues to operate and strengthen its capacity to serve those who have low income and uninsured needs. It is also imperative that we continue to work collaboratively to eliminate racial health disparities and access to quality health care. I reemphasize access to quality health care, health education, access to care, multi-level and intergenerational communication will help us improve health disparities and lead to better health outcomes. As many have mentioned, as the pandemic enters into its third year, and who would imagine that we will be entering into our third year on March the 3rd, I believe. This year's focus on health and wellness provides an opportunity to honor our past, celebrate our accomplishments, and press forward for progress. Press forward for progress. Today, we celebrate Black History Month together, and we all collectively and collaboratively look forward to a healthier tomorrow in all of our communities. Thank you, Council President Albornoz, for allowing me to bring brief remarks this morning.
Thank you so much, Dr. Bridgers and Dr. Crow. We appreciate your leadership and that of your entire team. Next, we will hear from my colleagues. Colleagues, we're going to start with Councilmember Navarro, and then we're going to have Council Vice President Glass, followed by Councilmember Katz. Then we will hear from Councilmember Reamer, then Councilmember Hucker, and then Councilmember Friedson. Councilmember Navarro.
Thank you so much, Mr. President. It is such an honor to be with all of you today. This is a very important celebration every single year. I'm so inspired and just really, fired up to continue the hard work because it is truly a community. And this is what is the best thing about Montgomery County. This is why I chose to move to Montgomery County 31 years ago when my husband and I were going to have our first daughter, precisely because of the extraordinary resilience, the example, and the sense of community that exists here in our county. And it's only gotten better. And so I just want to use my brief time to just do some shout outs here because it's so important. Dr. Gales, what an extraordinary leader in a very difficult time. Dr. Kroll, who I know when he decided to take this position had no idea he would be thrown into this chaotic situation to make sense of such a crisis, and that sense of responsibility he just took on, head on and just led us as well. Dr. Bridgers, who has continued to guide us with his calm demeanor and really truly has been leading us through this, roller coaster where we think that we're done and then we get thrown back into the thick of it. He has been there to lead us and give us great advice every step of the way. So I want to say thank you. I want to thank our community partners, and in particular, people like Pat Grant and Byron Johns, because again, none of us has had a manual to deal with this pandemic. And then the most egregious part of the pandemic, and the part that I know I was so worried about from the very beginning, was that we all knew that the disparities would be exacerbated, and we knew where exactly our communities that were going to be most impacted resided. And it was just extraordinary to get together over literally a weekend, Council President Albornoz and I, and we just had this aha moment that, we're going to have to be targeted, and we are going to have to put forth these targeted COVID-19 health initiatives. So we decided to come together, and we just had to summon everyone who has been working in this space. And within 4 days, they turned around these proposals for the Latino focused health, COVID-19 health initiative, and the African American program came to target the one for the Black community. And we turned to the executive and said, please fund this. And he did, and here we are. So I want to thank those leaders, because not only was it in the health space, but in the education space, the equity hubs. What an extraordinary model that now we have as a template to continue on as a best practice. As it was stated in the video, our faith-based communities and just everyone who literally just gave from their hearts, such generosity has been extraordinarily inspiring. I want to thank my colleagues, Councilmembers Rice and Jawanda, because they have, again, continued to not just represent all their constituents, but they understand that as people of color in these elected positions, we all have a responsibility to also highlight the very unique needs of our communities, because that's what equity actually is. And I know, because I've had personal experience with this, that a lot of times people want to criticize you and say you only care about this community and you only care about that community. Well, we are indeed multidimensional beings. We are capable of representing all of our constituents, but we also have a duty to speak truth to power and point out that there are disparities that require additional resources and targeted interventions. And so I want to salute them, because they have done this with grace. And I know with Councilmember Rice being term limited, he leaves a legacy that was started by people like Councilmember Valerie Urban, who was the first Black woman elected to the Montgomery County Council. These are important leaders that we have to make sure open the path and the way for others to walk through. Finally, I will say that, as a wife of a Black man and the mother of two Afro-Latina powerhouses, this has not been an easy time for the Black community. It has never been an easy time, but I think that when you layer all of these particular really life-defining events, like the last presidential administration, like the George Floyd murder, like the pandemic that has disproportionately affected the Black community, especially when it comes to death rates. It has been mentioned before, the mental health is going to be super important. And so in my household, we have a lot of conversations about, what should we expect now? It feels like the world has absolutely changed, perhaps permanently in so many ways. And so I hope that we continue this sense of collaboration, this sense of generosity, and also this sense of grace with each other to actually usher in a much better future. That this combination of factors that have been so difficult actually allows us to think of more opportunities, better opportunities for our young people and for our children. That is hopefully what we can do. And again, I salute all of you, because so many of you have just paved that way from years and years and years. Some of us now are about to pass the baton, and it is, I think, exciting to see what is possible because of your willingness to step up time and time again. Thank you.
Thank you so much, Councilmember Navarro. Council Vice President Glass.
Thank you, Mr. President, and good morning, everybody. I just want to say thank you for your love and your dedication to our community. Whether you are working in the faith community, the business community, government, or the nonprofit sector, we are one community. And while our community might not be perfect, it is because of your work and your compassion that we'll get there. And I'm hopeful and I'm confident of that together we can do that. And whether it is creating greater economic opportunities, to ensuring housing fairness, to transportation equity, this is the work that we all have committed to doing here in our own community, here in Montgomery County, because quite frankly, there is no other option. And we have to do right by all of our residents, especially those who haven't been treated right historically. And Black History Month should be a time not only to honor and celebrate the history of our African-American elders and predecessors, but I think more importantly, it should be a time for us to recommit ourselves to the important work that we need to do here at home. And I look forward to continuing to do that work with each and every one of you, and I appreciate you for your long-standing dedication to doing that work and to holding our hands as we continue moving forward to making progress that is fair and right for all of our residents. So thank you very much for being here this morning, Mr. President. I yield back.
Thank you so much. Councilmember Katz.
Thank you very much, Mr. President. And I, too, am very honored to be here and see so many friends, some of whom have been lifelong friends on this call, some of whom are newer friends. And it brings back such memories. And anyone that's ever heard me speak knows that I enjoy the history, and I enjoy the history of Montgomery County. And many people on this call have given me history lessons on things I didn't know about Montgomery County, and I'm most appreciative of that. But it is so very important to talk about the health as part of history, because that in itself is a great reminder of how the inequities have truly been horrible to people in Montgomery County and beyond. It's truly gratifying to be reminded. The doctor earlier mentioned about conscious bias and unconscious bias. And the unconscious bias is what's been, I guess, haunting, if that's a fair term for me, all along. I'm someone that truly believed that my conscious bias, I was always someone that was aware of my conscious bias, but the unconscious bias during all of our training has truly brought a different message to me. And I appreciated the talking about the mind, body, and soul, and that's what we all need to do. And I was reminded, and Councilmember Navarro certainly was the great driving force about the racial equity and social justice legislation that we had, that we're all very proud of. And I remember, and in fact, I saw the video not too long ago. Someone had run across it and sent it to me. That it was the day it was signed, the day that I became the council president. And I remember jokingly, and of course everybody had worked on it for so long, especially Councilmember Navarro and all of my colleagues. But I remember joking and saying, this is the first day, can you imagine, of my council presidency, can you imagine what day 2 is going to be like? And everybody chuckled, thank goodness. And everybody said that they had my back. And it was, but I have to tell you, right after that, and thank goodness everybody had my back, because right after that is when the pandemic started to hit. And we all needed to come together in a very different way, including racial equity and social justice. But we all needed to come together in a very different way that we had never, ever planned on. And why would you? I mean, a pandemic every 100 years, and it had to hit my time, our time. I could go on, and I'm not, Mr. President. I know that this is a long day for all of us. But I think it is so very important to remember, and many of my colleagues and others have heard me say that I believe the community is a family. And it's so very important to remember that a community standing together is strong. But when all communities stand together, that's when we're strongest. So thank you, and united, we win. Thank you very much, Mr. President. I yield back.
Thank you so much. Councilmember Reamer.
Thank you. It's so nice to be joined by such an illustrious group today. It's really an honor, and I want to thank everyone for taking the time to be here with us. It's an exciting day. Black history is American history. I think that's really the essential truth. And there is nothing in this country that we see today that isn't the result of that history. And it doesn't matter where you live in America, everything you see around you is somehow influenced by our history, and particularly the history of race and of the struggle for freedom of Black people in this country. And that is why we can't tackle the problems that we have today without confronting our past. And we have to understand that past truly and stop hiding it and confronting it. And what we're seeing now today is very troubling. We have a lot of states and localities that are actually passing laws that are intended to prohibit or intimidate teachers from educating students about the history of race in our country. It is, very, very concerning. But in places like Montgomery County, we can lead. In Maryland, we can lead. We're the home of Frederick Douglass and Harriet Tubman, and here in Montgomery County, the home of Josiah Henson. And we are a community with
a rich history of Black resistance and freedom despite slavery and racial oppression. And so while we celebrate that history today, the history of Black people in our community and Black communities here in Montgomery County, we know that this work, it's our job every day and every week and every month. And there is no stopping and there is no resting. So thank you for all of our community leaders for working together and helping us find opportunities to make a difference. I'm really glad to be with you here today. Back to you, Mr. Council President.
Thank you so much, Councilmember Reamer. Councilmember Hooker.
Thank you, Mr. President. Good morning, everyone. Thank you so much for joining us. What an all-star lineup we have this morning. It's a good morning talent we have in Montgomery County. Very few counties could assemble a lineup like this. An honor to be here with all of you, especially my predecessors in my seat, council members Irvin and Branson, whose advice I'm always grateful for. You all know well at the Medical Committee for Human Rights, it was 54 years ago, Martin Luther King said, of all the forms of equality, injustice in healthcare is the most shocking and inhumane. And it's so disappointing that injustice is still so stark and here and across the country 54 years later, and we're still challenged to address it. We're obviously not done, nowhere near done, but I don't want to miss the chance to say what others have said, that I'm so proud of what this council has done working with the administration and our community partners over the last 18 months to address the racial equity gaps that we saw first in testing and then in vaccinations. And I'm very grateful to the NAACP branch and Ms. Plummer and Branson for recognizing our focus on that. As Councilmember Navarro said, none of us had a manual to get through the last 2 years, but I'm very thankful that we know a lot more now than we did then. And I'm proud of what Councilmember Navarro called out about our efforts as the council to address those equity gaps and her leadership, and Council President Albornoz and Councilmembers Rice and Jawanda as well, and all of our colleagues and partners. It was really a team effort to address those disparities that we had. We absolutely have a duty to speak truth to power. That's very true, and we can't be satisfied with the progress we've made. It took years to create the systematic inequality in our healthcare system. It's going to take a long time to dismantle it. And we all know how much work we have to do, but we shouldn't miss the chance to celebrate milestones like what we've seen and what we're talking about today. So again, it's a pleasure serving on a council so focused on this and addressing wellness and working alongside all of our great community partners. And I really look forward to continuing to work with you on this in the future, because we're nowhere near done, as you all know. Thank you, Mr. President.
Thank you so much, Councilmember Hooker. Councilmember Friedson.
Thank you, Mr. President. I am so humbled to be part of this commemoration and to join such an incredible and illustrious group of community leaders and to talk about these important issues. And much of my thoughts have been said, but I just wanted to note Frederick Douglass, great Marylander who has been noted a couple times here, said we have to do with our past only as we can make it useful for the present and the future. And I really do think that that is what today is all about. That is what this conversation is about. When we talk about these issues, Black history is Maryland history and American history, as has been noted. But everything that we talk about today is both part of history from a collective standpoint and from an individual standpoint. We were talking earlier about the discrepancies when it comes to COVID, when it comes to HIV, when it comes to cancer, when it comes to so many health disparities, and ever more true, and Councilmember Jawanda noted this, when it comes to pregnancy-related issues. 2/3 of pregnancy-related issues and pregnancy-related deaths are preventable, and that is disproportionately felt and impacted by the Black community. Black pregnant people are 3 times more likely to birth children with low birth weight. The numbers are staggering, and so when we talk about the issues that face our community and that face the Black community that collectively are rooted from before any of us were here, individual issues related to health and wellness begin before children are born. And that is what makes this work so important and so challenging. It's not a choice that anybody is making. to be born with the challenges that they face. And so it's up to us as a community and as a society to stand up and to be as intentional in dismantling those challenges as those structures were intentional in being created as barriers of oppression. When we talk about Black history in Montgomery County and in Maryland and in the United States of America, we have the triumphs, and there are so many people on this commemoration who represent those triumphs. We also have the tragedies, and we have to confront both, and we have to recognize both, and we have to commemorate both. We also have the racial terrorism that still plagues our community as well, and we have to confront it, and we have to live up to the challenges that it requires in order to reverse the issues that we face as a community, because unless everybody in our community is able to reach their full potential, then no one in our community and our community as a whole cannot reach its full potential. So thank you for all of the work that you have done in our community. Thank you for being part of this commemoration, and certainly we have a lot more work to do to make this history useful for the present and for the future in Montgomery County and beyond. Thank you so much, Mr. President.
Thank you so much to all of my colleagues. Those were incredible comments from all of you. We are now going to hear from some community leaders that are in the audience today. First, we will hear from Ms. Cherie Branson, our former colleague on the County Council and my former colleague in the previous Leggett administration. We will then hear from Ms. Anita Neal Powell, then Ms. Denise Jones. Then we will hear from Reverend Kendra Smith. And finally, we will hear from Ms. Jacqueline Williams on behalf of our African American Health Program. Ms. Branson, I turn it over to you to make some comments.
Thank you so much. She said, my name is Cherie Branson. I am here on behalf of Montgomery County NAACP. I want to thank you all for inviting the NAACP to this lovely program on Black history. I first need to acknowledge the longstanding work of the African American Health Program. You know, they have been truly laborers in the field. And you know, as they say, their work is much, but the laborers are few. They have been working literally for decades. And so I want to acknowledge them and make sure they get all the recognition and money that they should get. I want to also, you know, I want to quote Lao Tse, who said, you know, everyone knows that water can run through rocks, but few people act accordingly. And when it comes to the situation we face with health disparities, everyone knows it, but few people act accordingly. I have, we all understand the social and economic determinants of health-related disparities. We all understand hypertension and diabetes and stroke and maternal mortality have underlying conditions that are both social as well as physical. The social has everything to do with the stress that is caused by being Black in America. If we don't acknowledge that, then we're never going to get past this. The absolute need to cope with the stress of racism is what leads to much of the harm in our mental and physical well-being. If we don't acknowledge this water, we'll never figure out how to build this dam. I want to close out by quoting Councilman Andrew Friedson, who said something I thought was absolutely brilliant. He said, we have to be as intentional in knocking down these barriers as the people were who created these barriers. So I really want to thank the members of this council for your intention, your work, the way you have genuinely put money to meet problems. But I want to ask you to be more intentional too, because the problems haven't gone away. It is about the way we live every day. So I should probably stop there before I get in more trouble. And so for the Montgomery County NAACP, once again, I thank you for including us.
Thank you so much for pointed remarks. Ms. Anita Neal Powell.
Good morning, Council President Gabe Albornoz, Vice Council President Evan Glass, members of the Montgomery County Council, and special guests who are here today to be included in the annual Black History Month program, Black Health and Wellness, as this year's honorees. On behalf of the Lincoln Park Historical Foundation and the Leroy E. Neal African American Research Center, I congratulate the Council for spearheading this annual program since 2015, starting with former President George Leventhal, who recognized Black people and communities across the county. I also congratulate today's honorees, who have been very active in the community and in the county and are deserving of this recognition. The theme of Black health and wellness is a more fitting for this occasion, especially since we are still going through the mass undertaking of staying healthy, washing hands, staying in your lane, and not getting close to each other in public spaces, and wearing your mask because we want to stay healthy and keep others safe. Thank you, honorees, for doing what you are doing through community outreach, webinars, training, and partnering with faith-based organization and the African American Health Program to give free COVID tests, booster shots, and vaccinations, to distribute food and offer programs to keep us physically and mentally fit, and more. We are really grateful to each of you and to the Montgomery County Council for its recognition of you and your community services. Finally, Black history is superpower, and you are doing your part in keeping us safe and informed. President Albornoz, thank you for inviting me to share a few remarks of congratulations to our honorees this morning.
Thank you so much. Next, we'll hear from Ms. Denise Jones.
Good morning. I want to thank the Council and in particular Councilmember Evan Glass for the invitation to join you for this celebration of Black History Month in Montgomery County. The focus of Black health and wellness is timely in this time of social movement of racial equity and social justice. In the midst of the COVID-19 pandemic, the health disparities are in stark relief. I'm not a healthcare professional, but my work as a small business owner of Brasser & Company in Montgomery County is an uplifting social emotional wellness through my work as a teaching artist and arts administrator to bring arts and STEAM programs in a variety of disciplines to support Montgomery County residents of all ages. My Healthy Families, Healthy Communities project, delivered with my organizational partner, Carpe Diem Arts, is specifically designed to help serve our residents to break down racial barriers, break down unconscious bias, and to support the development of individual agency to create a healthier society and community for all. The Healthy Families, Healthy Communities program serve through parents' workshops, adult art engagement, early child learning through movement and music, the social emotional wellness of adolescent girls, healthy cooking classes to nourish our bodies and minds, dance for fun and fitness, bringing a variety of cultural dances, and a community art project, and of course, music for a shared memorable experience that nurtures our spirit. The arts can be a wide, welcoming bridge to serve the individual and offering space for creative solutions together. When we know one another, we work better together. I'd also like to take this moment to thank Council Members Glass and Rice for their advocacy in the Council, providing more money for the arts last year when we so badly needed arts interventions. And again, the Council is to be acknowledged for the additional monies provided for increased service to seniors. The arts heal, and I'm happy to be working in collaborative Montgomery County to serve your constituents and my neighbors everywhere. Thank you.
Thank you. So beautifully said. Now next we'll hear from Reverend Kendra Smith.
Good morning, everyone. Thank you on behalf of our pastor, Senior Pastor Reverend Matthew L. Watley. We are so delighted to be here today, and thank you so very much for allowing us to be a part of this wonderful celebration. As was already shared, just the role of the African American church in our communities is critical. And we have, as a collective, been just involved in every aspect of life as it relates to the Black community. And it is a privilege, it is an honor, it is indeed our honor to serve. It is our pleasure to serve, and we are glad to be a small representation of all of the other churches and faith-based organizations that are working collectively in Montgomery County to respond to the needs. We are one church, but there are many other churches, as you all very well know, and faith-based organizations that are serving and continue to serve. We have been able to do this through partnership. And so we are excited about the collaborative partnerships that we have with many of you that are already here, the African American Health Program, Holy Cross Health. That is how we have been able to continue to serve since March 2020, the beginning of this pandemic. And we're committed to serve. We are consistently concerned about the holistic health issues of our people. And we will continue to do whatever is necessary to ensure that we stay on the front lines to work collaboratively with you and all in order to respond to these issues and to help our people and all people to live a full, abundant, and strong and better life. Thank you again so very much for the opportunity to be a part of this wonderful and beautiful celebration. And we look forward to our continued partnership together. Thanks so much.
Thank you, Reverend Smith. I think it's especially appropriate to say amen. Absolutely. Last, among our speakers in this distinguished audience, we're going to hear from Ms. Jacqueline Williams speaking on behalf of our African American Health Program. I'm so glad Ms. Branson, especially in her comments, uplifted the work of the African American Health Program. I can speak in the first person about their remarkable work in the community, especially these last 2 years. And for generations, they have been leading the way in so many ways. So Ms. Williams, thank you so much for joining us today.
Thank you so much. I want to thank you for the opportunity, Councilman Alvarez and Vice President Glass, to give us a chance to talk about the, to celebrate the Black History Month. Pat, Grant, and I will be a tag team today. Throughout history, the Black population has been a resilient people in the face of adversity. COVID highlighted the serious gaps in healthcare nationally, statewide, and locally within Montgomery County. During the worst of the pandemic, the Black population had high numbers of deaths and cases, in part due to underlying health conditions, which caused premature death. Though our healthcare system is fractured, the African American Health Program will be there to help mend the gaps in healthcare in order to forge better health outcomes for the Black population in Montgomery County. We, as Black people, stand on the shoulders of those who fought for our liberty, our rights, and our future. This includes our stalwart religious leaders, as you've heard, our steadfast community activists, thank you, Cherie, our resilient families, and our emerging youth movement, who are our future. The future is now. Thank you again, council members, for the recognition of Black History Month. Much appreciation. Pat?
I didn't know my mic was on, I'm sorry. Council President Albornoz, Vice President Glass, and all of the council members assembled here today. Last night, I read an article that said, while slavery may have ended for some in 1865, racism did not. This brought to mind the resolutions that were passed by the council. One, racism is a public health crisis, and the Racial Equity and Social Justice Act. And I commend each of you for passing those resolutions. As we look at Black history, we need to determine how we end the issues around disparities, inequities, and inequalities in our health and healthcare systems. I read another article and I saw a picture of a man holding up a sign that gave me some pause and hope. And this was, in my mind, the beginning of a prevention strategy. The sign said, racism is a virus, and we are the vaccine. Just like we have come together to fight the COVID-19 pandemic, we can solve this greater pandemic of racism together. I want to say sorry to Councilmember Jawanda for what happened to you. Thank you, President Albornoz, and all of the county council members. I want to throw a shout out, if I can, to the two who helped us through the testing, who are our co-sponsors for getting the COVID-19 project off of the ground, and it's Councilmembers Rice and Councilmember Jawanda. And but I want to thank the council for what you do each and every day, and for this Black History Month celebration. It is really appreciated. Thank you.
Thank you so much to both of you and all of the speakers. We're now going to read the proclamation, colleagues, so please pull it up. We're going to tag team this, and then we're going to end with the beautiful poetry reading. So let's, I'll give all of my colleagues a moment just to bring up the proclamation. And of course, this is a proclamation of the Montgomery County Council. Whereas February is Black History Month, which recognizes and honors the history and contributions that African Americans have made to this country. And
whereas in 1926, Black educator and historian Carter G. Woodson moved to officially recognize the achievements and contributions of African Americans to our nation's history and identity. And
whereas Black history is complicated and unlike any other story ever told. Enslaved Africans were brought to this country under brutal conditions, and those who survived birthed generations of people who became physicians, educators, scientists, and world changers. And
whereas Maryland is home to African American heroes like Frederick Douglass, Josiah Henson, Harriet Tubman, and Thurgood Marshall, who paved the way for young activists of today who continue the fight for racial equity, freedom, and social justice. And
whereas, despite the many contributions they have made and continue to make to this country, the Centers for Disease Control and Prevention reports that African Americans are more likely to die earlier of all causes, as young African Americans are living with diseases that are typically more common at older ages for other races. And
whereas racial disparities in health coverage, chronic health conditions, mental health, and mortality persist in this country. These disparities are a result of decades of systemic inequality in American economic, housing, and healthcare systems. And
whereas African American medical pioneers in the United States shattered stereotypes, broke barriers, and went on to conduct research, discover treatments, and provide leadership that improved the health of millions of people of all races in this country. And
whereas African American medical pioneers in the United States shattered stereotypes, broke barriers, and went on to conduct research, discover treatments, and provide leadership that improved the health of millions of people of all races in this country.
And whereas throughout the month of February and all year, Montgomery County will continue to celebrate Black History Month and the African Americans who contributed significantly to the growth and development of our county and our nation through distinguished leadership in the field of health.
Now, therefore, it be resolved that the County Council of Montgomery County, Maryland hereby proclaims February as Black History Month, presented on this 15th day of February, signed by myself and Councilmembers Rice and Jawanda. Thank you all so much. Council Vice President Glass will now introduce our final speaker.
Well, thank you, everybody. It has been a beautiful morning, a show of our commitment to our community and the work that needs to move forward. And as we look toward that future, that bright future, I am really excited to introduce Emily Comby, who is a student at the University of Maryland studying public policy, where she is a Banneker Key Scholar. Emily is also an intern in my office, and she is also a lifelong lover of poetry. She's actually a slam poet and strongly believes in using the arts, and specifically poetry, as a vehicle for social justice. And while she is in my office, she communicates with all the residents of Montgomery County, and I am excited for her to share her talents right now with you by reading a poem from Maya Angelou that will help inspire all of us as we work together to make our community even stronger, more fair, and more equitable. And Emily, I turn it over to you.
Thank you, Councilmember Vice President Glass. Good morning, everybody. Happy Black History Month. I want to thank you so much for the opportunity to perform. Maya Angelou is one of my favorite poets. So without further ado, this is Still I Rise by Maya Angelou. You may write me down in history. You may trod on me in the very dirt, but still like dust I'll rise. Does my sassiness upset you? Why are you beset with gloom? 'Cause I walk like I've got oil wells pumping in my living room, just like moons and like suns with the certainty of tides, just like hopes springing high, still I rise. Did you want me to be broken? Bowed head and lowered eyes, shoulders falling down like teardrops, weakened by my soulful cries. Does my haughtiness offend you? Don't you take it awful hard, 'cause I laugh like I've got gold mines digging in my own backyard. You may shoot me with your words, you may cut me with your eyes, you may kill me with your hatefulness, but still, like air, I'll rise. Does my sexiness upset you? Does it come as a surprise that I dance like I've got diamonds at the meeting of my thighs? Out of the huts of history's shame, I rise up from a past that is rooted in pain. I rise on a black ocean, leaping and wide, welling and swelling, I bear in the tide, leaving behind nights of terror and fear. I rise into a daybreak that is wondrously clear. I rise, bringing the gifts that my ancestors gave. I am the dream and the hope of the slave. I rise, I rise, I rise. Thank you.
Okay, that was incredible. Thank you all so much. This has been spectacular. I know we went over, but we needed to, given everything that we've all been through. So thank you all so much. This is especially poignant and such an important time for us to continue to come together as a community to reflect on our past and move forward together. Thank you all so much for joining us. We are going to move on to the next item on the agenda this morning. And I know, colleagues, you're looking at your watches as I am too, but we're going to be okay. I believe our public health briefing today will not be as long, thank God, as it normally is, because the news is much better than it has been. But the next proclamation is recognizing somebody who I had the opportunity to serve with for 12 years in the previous administration, and that is Miss Linda Herman. And we are recognizing her years of service as Executive Director of the Montgomery County Employee Retirement Plan. And I'm going to be joined by my colleague and friend and chair of our Government Operations and Fiscal Policy Committee, Nancy Navarro, on this one. And we're going to limit it to just the two of us so that we can get through the rest of our presentations this morning, because there is so much to get to. And I know that she will speak so diligently on behalf of her colleagues on the committee. But Linda, I want to personally thank you for your public service. You have maintained, and I want to make sure I get this number right, a portfolio with assets of more than $8 billion over the course of your career. And the investments that you've made, the way that you have stewarded us through some pretty challenging times as a community, and the way that you have your steadfast leadership and advice and guidance is really so important to honor and recognize the sacrifices of all of our people who decide to serve and work for our county government, to serve our public in the way that they do. So thank you so much, Linda. I'm going to turn it over to the chair of our Government Operations and Fiscal Policy Committee, Councilmember Navarro, and then we'll read the proclamation for you. Councilmember Navarro.
Thank you, Mr. President. So the Government Operations and Fiscal Policy Committee has worked closely with Ms. Herman on every aspect of the county's retirement plans. And we are proud of what we have all accomplished together, going back to the extremely hard years of the Great Recession. We know that the Trust's top-tier investment performance has meant that less support from county funds has been needed. This has greatly benefited our taxpayers. The outstanding investment performance speaks for itself, but Linda has also joined with us in being among the leaders in focusing on environment, social, and governance issues, also known as ESG. Our retirement plans are complex and have many moving parts, and the GO committee has always enjoyed working with Linda to address them. Her expertise and her ability to understand the concerns of all parties have been a great asset. Her advice and her steadfast leadership has served Montgomery County very, very well. So I know that when I heard that, Linda was retiring, I was just like, what? No, it is hard because we get used to counting on the expertise and the incredible talent of employees like Linda. But in this particular instance, when we're talking about necessary funds to fulfill our commitment to our employees, I have to say that under her leadership, her stewardship, again, we have been served extraordinarily well. So I wish you all the best in your endeavors, and it has actually been such a pleasure. I will say on behalf of my Government Operations and Fiscal Policy Committee colleagues, but also the entire council, it's been really a pleasure to work with you.
Thank you so much, Chair Navarro. We are going to hear from Councilmembers Friedson and Katz as well, and then I will read the proclamation. Councilmember Friedson, followed by Councilmember Katz.
Thank you, Council President. Sorry, Madam Chair, we couldn't help ourselves in bolstering your comments. I just wanted to thank you, Linda, for all of your work. It's been a privilege and a pleasure to work with you and to have your expertise. And we've been lucky to have that, but so have the residents of Montgomery County, so have the employees of our workforce to have a secure retirement because of your diligence and your leadership. And I just wanted to note, my previous job, part of my portfolio was the state retirement and pension system. And I can just tell you from a state perspective that Linda really has a reputation across the state and throughout the country, really, for her professionalism, for her thoughtfulness, for her expertise. And when the 15th seat was established by the General Assembly in 2013, I believe it was, there really was not a whole lot of conversation and discussion. It was obvious who was going to represent a county perspective on the board. And that speaks to how fortunate we have been to have Linda here in the county. It speaks to how lucky residents are, and you certainly are going to be a significant act to follow. So thank you so much for your leadership. Thank you so much for providing us with your expertise, and we wish you well, and sad to see you go.
Councilmember Katz.
Thank you very much, and I will be very, very brief, but I certainly wanted to take the moment to very publicly thank a lady by the name of Linda Herman for all that she's done. It's been mentioned that you have overseen an investment of more than $8 billion, and we probably owe you 10 billion thank yous. You have done an unbelievably good job. You have worked to reduce fees. You've worked to make certain that the employees and the former employees will have a good life because of the compensations that they will be receiving. And so on behalf of thousands of employees who have decided that public service was something for them, and because of that, you have given them something beyond their public service. So we thank you, and candidly, if there could be a term for an unsung hero, there should be the Linda Herman Award. Thank you very much, Linda.
Thank you so much. I'm going to read the proclamation, and then Linda, turn it over to you to say a couple of words. First, Proclamation of Montgomery County Council. Whereas in April 2004, Linda Herman was appointed Executive Director of the Montgomery County Employee Retirement Plan, and whereas MCERP is of vital importance to county employees, retirees, and taxpayers, it oversees the investments of assets for the county's pension fund, retirement savings plan, and deferred compensation plan, as well as the Consolidated Retiree Health Benefits Trust for the county, MCPS, and Montgomery College. And whereas from 1999 to her appointment as Executive Director, Linda served as Senior Investment Officer for the board, where she has been responsible for managing the investment programs for the county's defined benefit, defined contribution, and deferred compensation plans. And whereas under Linda's management, total assets have grown from $2.3 billion to $8.1 billion, and the 10-year return of annualized 9.7% ranks in the top decile of the peer group universe. And whereas, unlike the many pension plans across the nation that have suffered from lax administration and in some cases malfeasance, MCERP has earned a stellar reputation in all aspects of its work. And there are several other whereases, but I just want to conclude by saying, although her leadership in shepherding the funds, which are some of the most successful public pension funds in the country, will be tremendously missed, we wish Linda all the best in her next endeavor. Now, therefore, be it resolved that the Montgomery County Council hereby thanks Linda Herman for serving the county with intelligence, integrity, and innovation, and wishes her all the best as she begins the next chapter in her life. Presented on this 15th day of February in the year 2022, signed by myself. And congratulations, Linda. This is bittersweet for us, but we turn it over to you to make some comments. I think you put yourself on mute.
Am I okay now?
You're kind of breaking up, Linda. Now we can hear you. Try. Go ahead.
Okay. Okay, great. Thank you for your kind and thoughtful comments. It's been a privilege to work with all of you. You know, they say it takes a village to raise a child. Well, I think it takes a great team to manage successful retirement programs. And I'm very grateful to everyone on our team, our dedicated trustees and staff, our expert investment advisors, the county departments we work with, human resources and payroll in particular, and of course the county council. You've been a pillar of strength in these very challenging times over the last few decades. And I'm just very honored that I was given the opportunity to work at Montgomery County. Thank you so much.
Linda, thank you again. We'll never be able to thank you enough for all of your contributions. We now move on to the final proclamation before going on to general business, and that is a proclamation recognizing Library Lovers Month by Councilmember Jawanda. Councilmember Jawanda.
Thank you, Mr. President, and we've had a really great morning here. So this will be efficient, but also got to celebrate our libraries. And I think we have Sonia Roberts, the chair of the library board, and Ari Brooks, who is the executive director of Friends of the Library, with us today. There we go. I see you both. Good to see you. And you know, this is Library Lovers Month, one of my favorite months as the lead for libraries, even before I was lead for libraries. But boy, if you needed another reason to love our libraries, you got it during the pandemic. You know, not only the core mission of maintaining our history, we celebrated Black History Month today, and maintaining truth, right? We're at a period of time where that is at risk, and books are being banned, and in neighboring jurisdictions and other places, and our libraries obviously are not partaking in any of that, and are open and have been consistent throughout. The free educational resources that you provide, the economic development tool that our libraries, the people can come in, they're open to all, they can upskill, they can apply for that job. We've gotten tons of stories throughout the pandemic. I read one a few months ago about someone who researched, applied, did their interview, and got hired at a public library in Montgomery County, all throughout. And not to mention the literally tens, almost millions, I was trying to get the exact number, but hundreds of thousands of test kits and masks that were distributed over the last several months by our library employees. Our libraries have done everything all the time. And so we say thank you. This is a special Library Lovers Month. You take us on journeys without ever leaving, but you support the community in so many ways as our community hubs. And I want to thank all the employees and all of our residents know how important our libraries are. So visit your local branch. We have 21 public branches. I've been to all of them. I've been to the one in our jail facility as well. They all have something great to offer. My home branch of Long Branch when I grew up and White Oak now, they're awesome branches. So go visit all of them. I'll read this proclamation and then I'll turn it over just briefly to Ari and Sonia to see if they have, well, they do have something to say, but I'll turn it over to them right after I read the proclamation here. Whereas libraries provide unparalleled public services to all of our residents of our county, providing access to new languages, assistance to find jobs, and support for all students. Whereas libraries serve as a vibrant community hub, providing all residents with access to resources that allow them to grow, share, learn, and thrive. And whereas libraries perform a critical role in educating the public and enhancing the culture of our diverse community. And whereas libraries have served as an invaluable resource during the COVID-19 pandemic by providing countless public resources, innovating to respond to unprecedented challenges, serving as a distribution hub to pass out free COVID-19 tests and masks. And whereas librarians and educators are keepers of the magic of the written word. And whereas Friends of the Library of Montgomery County is an invaluable nonprofit that supports Montgomery County Public Libraries and promotes the importance of access to lifelong learning. Whereas libraries provide us an entryway to new worlds, truths about our past, and equip us with the knowledge we need to build a better, more equitable future. And whereas libraries serve as a safe space in our community for children to grow, learn, and develop their imaginations, develop the inquisitive minds we need in the next generation. Therefore, be it resolved that the County Council of Montgomery County, Maryland recognizes the month of February as Library Lovers Month, signed by the Council President and myself on behalf of the entire Council. And I want to turn it over first to Sonia and then to Ari, and thank you all for all the work that you all do.
Thank you so much for having us today. This is very exciting, especially during Black History Month. That was really, it held a special place in my heart. So thank you for having us. Thank you for recognizing the work of the fabulous library staff, Anita Vassallo and her entire team. They have been all things, especially during the pandemic. And I'm just honored to come before you today during Library Lovers Month. And just to say thank you for the council, all of you, for supporting the work of the library and providing a valuable resource to the entire Montgomery County community and all of the diverse neighborhoods. The library is all things, and that has been a wonderful addition to our county. So we thank you for all of the support of Mr. Jawanda and of all the county council members. We're excited the work that the library does in just providing, promoting literacy, early childhood education, decreasing the digital divide, and all of the wonderful things that the library provides in the community. So thank you for this. We appreciate it.
Thank you. Ari?
Thank you. Happy Library Lovers Month to everyone. And of course, as a woman of color, I would be remiss without wishing everyone happy Black History Month. I was also, as Sonia mentioned, very proud and very happy to be here and witness that program this morning. Thank you, Mr. Jawanda, for your unwavering work to understand the needs of all of the county residents as it pertains to library services, where of course you can go and learn about everything from our Black heroes to how to make healthy meals and how to be an anti-racist, not just this month, but all year long. And I'd especially like to thank the entire county council, President Albornoz and Vice President Glass, for this annual recognition of the value of libraries in our community. And I just urge you to continue to support libraries so that they can continue to serve and thrive, but particularly serve the entire Montgomery County community.
Thank you, Ari. And I got it from Dr. Stoddard while I was waiting. 750,000 test kits, 875,000 masks passed out by our libraries. And we're going to make a little Black history at one of our libraries too, like we do at all of them. And I wrote a letter, and many of my colleagues, I think, all support. We're going to be renaming, county executives confirmed that we will rename the Silver Spring Library after recently departed General McGee, Brigadier General McGee. And so that is really exciting. We're going to have our own Black history here at one of our libraries in a very special way. So thank you so much. Back to you, Mr. President.
Thank you so much. And thank you to both of you for your public service and your colleagues as well. We are now going to move on to general business. Madam Clerk, do we have any announcements?
Good morning, Mr. President, Mr. Vice President, council members. There are no announcements, but there is one petition. The County Council has received petitions from the residents of Montgomery County opposing Bill 4921, Police Accountability Board, Administrative Charging Committee established. That is all, Mr. President.
Thank you so much. Just a quick note for my colleagues, logistically, we are going to be shifting one item on the agenda to March 1st. That is item number 7, the briefing on the planning board draft of the Silver Spring and adjacent communities plan. We still have time before the Fed committee session on that, and that will free up a little bit more time this afternoon. The clerk has circulated the minutes of December 7th and January 25th for approval. Are there any changes? Seeing no changes, those minutes are approved. We will now sit as the Board of Health, and we had the shortest presentation we've ever had during our weekly press conferences by Mr. O'Donnell on Monday, in part because the numbers are continuing to decline so precipitously, thanks in large part both to our public health officials but mostly our community who has been adhering to the guidance because of our vaccination rates, because people continue to wear their masks. We are also joined, in addition to our public health officials, as we are every couple of weeks, by our colleagues in Montgomery County Public Schools. And of course, I'd be remiss once again to not acknowledge the historical appointment of Dr. Monifa McKnight as the head of our incredible school system, particularly during Black History Month. And although she's not with us today, we certainly once again send those congratulations and appreciate her leadership in so many ways. So with that, I will turn it over to you, Dr. Bridgers, to talk about where we are. Colleagues, obviously, we are on a limited time frame today, so I'm going to humbly request that we limit our questions to the 5-minute rule, if you have one at all. And so with that, Dr. Bridgers, I turn it over to you.
Good morning, Council President Albornoz, Council Vice President Glass, and all of the esteemed council members sitting this morning as the Board of Health. I won't spend a lot of time with my opening remarks. Many of the metrics that Mr. O'Donnell will walk through are in the Pulse report, and any additional information that Dr. Stoddard has based on our ongoing conversations about what it looks like as we move through this 5th wave of coronavirus 19 and what it looks like in our way forward. So having said that, I want to thank our Montgomery County citizens for being resilient and resourceful. We have gone through 4 waves, and there have been trials and tribulation, as I indicated last council session sitting as a Board of Health. In some instances, we've taken more conservative postures, moderate postures, and instances where data and science indicate that we can be more liberal. We've done so, and we're looking at all of those positions as we continue to plan our way forward in the coming months. Last month, on January the 14th, and looking at some of the data points that I wanted to highlight, we had 503 people hospitalized. Yesterday, we had 118 people hospitalized. Conversely, last month, we had 1,861 individual cases per 100,000 and a 22.2% test positivity rate. Yesterday, we had 98 cases, under 3%. As Councilmember Jawanda would always say in the reports, he's glad to see when we have the lowest test positivity rates in the state. We are below that threshold. This morning when I looked at the data, we were just above 3 at 3%. So we are trending in the right direction, and we need to be reminded of how we got there. We get vaccinated, we get boosted when our time is appropriate, we wear a mask if necessary, and we test when needed. So if we remember those things as we continue to move forward and get past this surge, we will be in a safer space as we've been, and that's how we got to our fully vaccinated rate of 84.7%. Lastly, speaking of boosters, we know that there's still a need to increase our capacity to boost. So we invite folks to come out and join us this Saturday, February 19th at the Westfield Wheaton Mall from 1 to 4 p.m., where we will have yet another Boosterama. And Mr. O'Donnell will go through some of that data and information as well. So with that, I thank everyone for all of their due diligence and great public health work as we continue to move forward and look past Omicron, but we aren't there yet. There is no clear end per se, but we are moving in the right direction. So I'll stop there, Mr. O'Donnell, and I'll turn it over to you to walk us through the pulse report.
Thank you, Dr. Bridgers. I just asked if someone could offer me the opportunity to share screen. Thank you very much. So on the heels of yesterday's media event, I'll try to see if I can make this as quick as possible again today. Our case rates are down to 98 cases per 100,000 over 7 days, and our positivity rates are down to 2.99%. So we're excited about seeing those numbers come down. Our vaccination totals, when you round up, we are now at the 85% total of our total population, just a little bit below it when you look at the fractions. We continue to get individuals coming out for boosters, not at a high rate, but that number is inching up a little bit. Now at our 18 and older populations are at 57% boosted. Again, our numbers on vaccination types and doses by age, these do trail by a week or two as it takes a little bit longer to collect this data. But you can see that the numbers of additional doses has come down each week. Looking at one of the things that we highlighted in the previous council sitting as the Board of Health meeting is the disparity in additional doses by race and age. We saw over the past week pretty much across the board, most of the groups went up by about 1%. We're hoping to make more significant progress as we continue to do outreach and try to communicate with all of our populations about the importance of being boosted, particularly with those that are 65 and older or with underlying health conditions who are at the most risk for COVID severe illness. We have not seen much change over the last week in the where vaccinations are occurring in our county for our 5 to 11-year-olds. That has notably slowed, although we're continuing to work with our MCPS partners on locations throughout the county to continue to try to bring out younger children as well as their parents and other family members or other people in the community who need a vaccination. I know some of these numbers were just shared, but the overall number of rapid test kits distributed is now more than 1.2 million throughout our community. The vast majority of those at libraries, as well as more than 850,000 masks distributed at libraries. We also have had more than 100,000 test kits distributed out to childcare, our private schools, as well as through our community nonprofits. And another 42,000 have gone out through HHS efforts, working with hard to reach communities, homeless populations, senior groups. So we've pushed out quite a lot of rapid test kits now. One thing that we do want to share with all of our community, we know there's a lot of interest in the next vaccination rollout for those who are under 5 years old. We are waiting on the emergency use authorization for a vaccine for that age group. We expect it will be the 6 month to under 5 years old population. The FDA was scheduled to meet today. However, they've postponed that meeting as they've received a lot of new data following the Omicron wave. And the Pfizer has advised them that they are going to continue with a trial of looking at a third dose for that population, looking at increasing the efficacy data that has come out. They expect to have that in early April, and we'll follow along and update the council as we get more information. And just as a reminder, we expect to have about 50,000 children in this age range who could be eligible for vaccination once that is approved by our state and federal partners. One thing that we wanted to provide an update to the council was we have updated our quarantine and isolation guidance late last week. It is now mirrors the state and federal guidance. If you recall, we had advised having a full 10-day isolation period for those who were under 5 years old. A lot of that came out of the fact that the updated guidance that was occurring from our CDC partners and our state partners happened in the middle of Omicron, when we felt that it was still a dangerous time to return early from isolation for unvaccinated populations. We've seen the data on outbreaks come down significantly over the last few weeks. It was in January, it was over 300 children were cases within the child care settings. As of a day or two ago, we had under 40 that were currently a case. So it is a very significant change. So now what we've aligned is that for isolation, anyone 2 and older is able to return from isolation after 5 days if their symptoms have improved and they know they have not had a fever for 24 hours. However, that's contingent upon being able to wear a mask consistently when around other individuals. And for the remainder of the 10 days of that isolation period. On return from isolation, continue to wear those masks, try to avoid being around individuals who are at higher risk. And there is guidance in those early childhood settings that if during nap times, meals, snacks, those are times when children are not advised to wear or unable to wear masks, but that those early childhood settings try to keep the children at least 6 feet apart if they're in that return from isolation protocol. The same is true if they're returning early from quarantine. For returning from quarantine, the recommendation is, again, children who are under 2 years of age should not return early from quarantine because, again, they're not advised to wear masks in any settings, and so they would not meet the CDC requirements. Those who are, though, 2 years and older and can consistently wear masks, if they have no symptoms, but they're not yet fully vaccinated or not boosted, even though they're eligible for boosted, should stay home for 5 days, wear a well-fitting mask around any others, whether at home or outside the home. It's recommended that after 5 days have passed that they test, and if it's negative, they can leave isolation, but they should continue to monitor for symptoms, and if they do develop symptoms, isolate it and retest. Again, for that period of time, individuals who return from quarantine under the 10 days should avoid being around people who are high risk and try to avoid travel if they can. And then for those who are fully vaccinated or eligible for boosters and have gotten boosted, they do not need to quarantine for those first 5 days, but for those full 10 days, they should wear a mask when around others. Again, monitor for symptoms, avoid people high risk, avoid travel. And again, they're recommended to test on after day 5 if possible. And finally, those who have tested positive for COVID within the last 90 days, if they are exposed to someone else, it's the same guidance as far as not needing to quarantine, but for 10 days to wear masks and monitor for symptoms. Again, avoid being around people who are high risk and avoid travel. They do not, they're not recommended to test after 5 days. Again, it's considered that they're protected because of their recent recovery from COVID. And then as Dr. Bridgers mentioned, there is a Boosterama that is occurring this Saturday through our partnership with Salud y Bienestar and Proyecto Salud. They will be at the Westfield Wheaton Mall between 1 and 4 p.m. In addition to giving boosters, they will be able to give first or second doses if that's something you need with the vaccine they have on hand. Additionally, they'll have some rapid test kits and some N95 masks to give away to folks who've come to get vaccinated. So those are the updates that we have from public health. At this point, would like to turn it over to Dr. Stoddard if he has anything to add.
Just one comment. I know that on social media there was a lot of discussion about the spectator rules with our recreation programming. Obviously, those will begin to shift. We've already talked about them. Those will begin to shift as the mask mandate ends. And so you can expect to see an announcement or some changes in those spaces. Moving forward, MCPS, obviously has been increasing their spectator allowance for each of the last several weeks. And we'll be going back to, I believe, 100% later over the next several weeks. And so just wanted to make that clear that those changes were already happening in the background, but obviously for the public's benefit to understand that along the same timelines of the mask mandate. So.
Thank you so much to all three of you. Mr. DeAndrea, what's MCPS's update? And if you can include in your update, Mr. DeAndrea, among the questions we're getting asked the most among constituents is what happens to the mask mandate among students and faculty and staff after the 21st. If you could just remind everyone what that process is and how those decisions are made, we'd appreciate it.
Absolutely. Good morning, President Albornoz, Vice President Glass, and members of the council. We will be very brief in our update, and we did plan to touch on the mask piece at the end of the update. Thankfully, as has been noted in multiple situations, the data has improved dramatically since January. So we will briefly touch base on the data and then just talk about a few other common questions that we've been receiving. So in terms of our overall COVID-19 case rates, this data just reflects information from right after we came back from winter break, that first week when we had more than 10,000 cases reported. And then you can see the past 2 weeks where obviously case numbers have gone down significantly to 455 and 353 respectively. And when we look at that on a day-to-day basis, you can see that very thankfully, when we were here 2 weeks ago, we were happy to say that the numbers had declined significantly. Those numbers have continued to decline even more if you look at the progress over the past couple of weeks. And we are very grateful for the partnership with DHHS and working together to implement mitigation measures that have helped in making this possible. As a result of obviously the challenges that we went through in January with the Omicron variant and really reflecting on and learning from those, we are in receipt of the information that was sent over yesterday evening regarding endemic health planning. And we're looking forward to the conversations with the council in March, where we talk about the work that we have been doing and will continue to be doing around what we have learned from what occurred with the tremendous spike in cases in January, and more importantly, how we're moving forward and the steps that we're taking as we think about health planning more broadly as part of the overall school system operations. So I just wanted to mention that we are looking forward to those upcoming discussions, and that's something that we have been working on and take very seriously, because as we move forward, and as Dr. McKnight has repeatedly said, throughout this entire pandemic, our goal has been to learn from all the different things that have been happening, improve our processes, and make sure that we are prepared moving forward. I do want to just briefly touch base on one item that I mentioned the last time that we were here in terms of the at-home rapid test kit distribution. We're very grateful that DHHS continues to provide 50,000 rapid test kits each week to us. And as a result, using those rapid test kits, plus some that we have procured separately, we are distributing rapid test kits to all students every 3 weeks through the month of March, which gives us spot checks on a periodic basis when people take the test and obviously report their positive results. Clearly, the numbers have continued to stay very low in alignment with the county numbers, but we recognize that this is one important overall mitigation measure. In addition, when we talk about things that we have learned from past experiences, and I know there were a lot of conversations about winter break and a return from winter break, we are making preparations so that we can distribute at-home rapid test kits prior to spring break and ask students to take those rapid test kits at the end of spring break prior to returning. This is obviously one key measure that we were not able to do during winter break due to the availability of tests. But just as we think more broadly about next steps moving forward, this is a really important next step and one example of kind of that overall health planning. And then we are continuing to have staff and students report their positive results through our COVID-19 reporting tool. That tool will be upgraded in the coming weeks, but right now it is a way for us to be able to monitor the cases in the school system. We had started that prior to winter break, and it was very helpful for us to have that data and obviously be able to share that data with all of you as well. The last piece I'll mention, just recognizing that we are short on time, is that we are very thankful that this is the second week that all schools continue to be in person. Those schools are currently in temporary virtual learning due to COVID or staffing disruptions. And we are very optimistic that this will continue, but we are continually monitoring the data. In addition, as I shared the last time that we were here, all of our bus routes continue to be served. We obviously had significant challenges during the first 3 weeks of January, but those have improved significantly since that time. This doesn't mean that there are not still regular delays and other bus challenges that have always been the case due to weather or accidents or things like that. But at the end of the day, all of our routes are served and there are no route cancellations. And then going back to what President Albornoz said at the beginning, so when the mask mandate is scheduled to expire for the county on February 21st, our mask mandate will stay in effect. No decisions have been made just yet regarding changes to the mask requirement in all MCPS facilities. We are currently reviewing the guidance that's provided by the Maryland State Department of Education, and we will be discussing this further at our Board of Education meeting next Thursday as well. And then we'll keep the council updated on the progress of those discussions. So with that, I will turn it back to you, President Albornoz.
Thank you so much, Mr. DeAndrea. Got a couple of hands up from colleagues. Councilmember Friedson.
Thank you very much. First of all, very glad to see where the numbers are. I think we're all excited about that, and very, relieved that all schools are in person as a result. So happy to see that. Thank everybody for their work and their efforts. Also wanted to thank Council President Albornoz and Chair Rice for the endemic planning memo that was sent and that was referenced here. And I just think that that's a good approach as we move forward. And I'm glad also to hear that MCPS is already looking at spring break, which we need to plan ahead of time, and glad to hear that those plans are underway and working with the health department to make sure you have the test kits and other materials and resources that you need in order to implement those plans ahead of time. So just want to acknowledge and thank that. Appreciate the update on the mask decisions related to public schools. I just wanted to get a sense of whether or not the health department was intending to make a recommendation, or whether MCPS was going to request a recommendation from the health department, or if this was going to be a decision that the school board was going to make pursuant to the state guidance that was provided recently.
Good morning, Councilmember Friedson, and thank you for that question. I should have been more explicit when I said that we're discussing this, and we'll be discussing with the Board of Education next week. Working with the Department of Health and Human Services is a critical part of that process. So absolutely, they will be part of those discussions, and we very much rely on their recommendations and advice as we have throughout the pandemic.
Councilmember Friedson, I've been in conversations with Dr. McKnight regarding the governor's charge to MSD, the questions therein, and so we've been having conversations of how that would look like the metrics that are set forth, 80% of the population being fully vaccinated, or a 2-week period. So as Mr. DeAndrea said, we are having conversations, and we will continue to look at the data and share those recommendations with council sitting as the Board of Health once we've decided the best way forward.
Appreciate that. Given that there have been thresholds that were identified at the state level, if there are going to be different thresholds that the health department is going to recommend and that ultimately MCPS may or may not follow, I think it's important that they be communicated clearly and publicly, what they are, how they differ, if they differ, and what we're going to be determining that decision based off of. So I think that will help the school board make its decision, and that will certainly help residents understand what decision is made. And obviously there's mixed opinions on like all of these issues, and I certainly understand and appreciate that, but I think it's very important that if there are recommendations that are coming from the health department to MCPS, that they be discussed publicly and shared publicly so that everybody understands what the decision is based off of. So I would appreciate that. Similarly, related to childcare, could you just explain, we talked today about the quarantine and isolation matching the state standards. Could you discuss once the indoor mask mandate is expired, a week from next week, on the 21st, what does that mean for childcare facilities in the county and independent schools, separate from MCPS?
So thank you, Councilmember Friedson, again for that question. I'll have Mr. O'Donnell walk through that again, but simply put, it means that masks will still be required for those individuals who are in childcare settings. As Mr. O'Donnell indicated, we still see some part of those individuals who are unvaccinated, who are under 5, still testing positive for the coronavirus through PCR tests. One of the opening comments that I indicated is that earlier in the summer, as we planned for our 5 to 11-year-old vaccination, I talked about modeling behavior. And so I recommend that our parents and our family members continue to model that behavior for those individuals who are unvaccinated and who should still wear a mask according to CDC throughout until they are eligible for vaccination. And so we've set those guidelines as set forth. As previously recommended, as Mr. DeAndrea also indicated, is that as we assess and have conversations about MCPS's public mask wearing mandate and the details of that, we will take those into consideration. But for those individuals who are under 5 years of age, they will still be required to wear a mask. Mr. O'Donnell, you want to walk through that again? I don't know if you want to bring up the slide so that we could get a visual and just hit those highlighted points again for Councilmember Friedson in response to this question.
As you do that, this is my final question, Mr. President. Thanks for that. Just clarify, it will be guidance to these childcare facilities, not a requirement. And
sure, absolutely. These are
to private schools. You're providing your best guidance on what you believe based on your medical expertise and that of the team that you are consulting. But ultimately, a decision, subsequent to the lifting of the indoor mask mandate would be up to the individual facilities. Is that accurate?
That's correct.
There are currently private schools that are going mask optional in Montgomery County today.
Mm-hmm.
So we're clear. So we know that those are already happening. Obviously, we have not stepped in to intervene to stop those schools. So just so we're clear that we know that that is happening already, and so that obviously is the prerogative of the facilities.
Correct. Unless there's an outbreak, and then we will take the appropriate public health response to mitigate and suppress that outbreak in that setting.
And yeah, if you want to add anything, that's fine. But that's all I have in terms of questions, Mr. President.
Thank you so much, Mr. O'Donnell. Do you want to speak to this, or?
I was just going to clarify that the difference is our guidance here was a return from isolation or quarantine, where a mask would be our guidance is recommended that they wear a mask in those settings, but as opposed to talking about individuals who are not returning from isolation or quarantine, where when that mask mandate goes away, and when the guidance from MSDE and Maryland Department of Health changes for school and early childhood. So just differentiating between those two, the folks who are coming back from a confirmed COVID diagnosis or an exposure to COVID, wearing masks versus those who are not in that category.
I appreciate that, Mr. O'Donnell. And just to follow up on Councilmember Friedson's point, I know this is, if we can just make that information as clear as possible and on the website, we continue to get questions. We'll probably get many more after the 21st. If we could just refer easily somewhere or to someone, that would be helpful so we don't inundate you all more than you're already inundated. I have Councilmember Reamer, followed by Councilmember Jawanda, and then we're going to try to wrap up our public health briefing and move on to district council session. Councilmember Reamer.
Thank you. Could you just say again, I think I missed it, after the 21st, what will be the status of mask requirements for private schools and daycare settings, childcare settings?
I'll speak to private schools, and we've had a conversation with the council. We've never applied the existing mask mandate as a requirement in private school settings.
Okay.
Just so we're clear about that. Most have obviously followed the mandatory requirements, and I think up until recently, I think I'm aware of at least one of the larger private high schools that has now moved into a mask optional stage, which is certainly currently, I mean, as in before the 21st, they've already done that. And so, it's been our view from the county attorney that, and having spoken to various council staff and members, it wasn't the intent for necessarily to apply to private school settings. And so we have not enforced it in the private school settings. And so obviously after the 21st, the same that obviously would apply. And so for
childcare, it's the same, except for there are specific rules around returning from quarantine or isolation where masking is applied.
And there may be also recommendations on top of that. So it depends. Obviously we're sort of waiting to see what will happen with MSD and Maryland Department of Health guidance. But I think generally speaking, you're correct. There may be guidance or recommendations that are made about various settings and kinds of things like that. But there will be no requirements.
Okay, I just want to say this again, because this is very interesting. It hadn't occurred to me until this morning. So you said that private schools are already not subject to our county mask requirements. So private schools have always been at their own discretion, unless it was mandated by the state or something like that. However, daycare and pre-K has been covered by the county requirement, and that will change effective the 21st.
Go ahead, Dr. Rich.
Go ahead, Dr. Stoddard. I'm speaking specifically to the recommendations that we continuously revise based on CDC and MSD guidance. Again, we will have a conversation with MCPS to look at those guidance and or recommendations consistent with what they've indicated as you referenced, Councilmember Reamer, regarding those isolation and quarantine guidelines. They will still be in place until we make the recommendations to our child care providers. We're also preparing additional information to coincide with the mask mandate sunsetting or expiring on the 21st to make it clear. We're also having a conversation with our early childhood child care team at HHS to make sure that folks are communicated or receive that communication in a timely manner, as Councilmember Friedson and I often talked about. So we're putting that together, but to answer to your question is, it will remain consistent with either the MCPS policy or the county policy, unless there's a situation where there's an isolation or quarantine recommendation in place.
So if the child care is in an MCPS building, it would be subject to MCPS rules. If it's in a private setting, it would be optional according to the county's rules, with, again, not including specific guidance for cases and how cases are handled in isolation and guidance in quarantine. That's very interesting. Thank you. So I wanted to continue on that thread here. in that I want to see us allowing tests to stay for childcare as we proceed. And I know it must be challenging. I'm sure there are complications, but fortunately cases are down so much that I think the impact of not allowing tests to stay has been reducing. It's been declining. The impact has been declining, but to require entire classes to isolate or just not be able to go into class is when they could test to remain just seems to be not providing enough of an allowance for families and for centers to use a testing regime, which many public health advocates are saying, or public health experts are saying, just do symptomatic. Don't even rely on test to stay. Just do symptomatic evaluation to stay. But we're not embracing that here in the county. But I think we ought to embrace test to stay. And again, learning that younger children will be absent some new regulation, will not be subject. I think that's helpful. Mm-hmm. I also think we've got a bigger job here to do, to explain to families and to kids these relative risks. And, on the positive side, like young kids who are safer than vaccinated adults. So it makes sense that when vaccinated adults aren't required to mask, that young kids would not be required to mask. They're just more protected by virtue of all kinds of factors that you know better than I do, but I'm just referring to the data. At the same time, I've had some interesting experiences talking to students about masking. And as part of my concern about school safety, I've been, as I've mentioned, volunteering in my kids' schools just to be an adult, positive presence at the school setting. And I've had a chance to sit down and talk to a lot of students about masking. And I've said, hey, if masking was optional, would you still mask? And, perhaps the responses that I get are reflective of the specific community of that school. I'm sure that's the case. But students were universally saying, absolutely, I'll continue to mask. And the reason is that they feel very unsafe. They feel very threatened, of course, by the virus. And I know we are hearing from a lot of parents who don't feel that way. But as we are grappling with this really complex issue, I think our kids need to hear from the county as to their level of safety and protection. And as cases are declining, and thankfully they are declining. And when we get to the point, what was the number? 26 cases in MCPS yesterday? Was that the number? Right. We got 160,000 students. Now, I guess we didn't test all 160,000, but the point is that's really low. We're down to 26 cases, in the whole school system. We've got to be able to help our students feel safer and to take these steps towards normalcy. So I know there's been a memo that has gone from Chair Rice and the Council President about, planning for endemic thinking and programming. But I think at a high level, that's the same idea here. Is we are fortunately moving into a period of much significant decline in the level of transmission and a general reality of being really much safer. And we need to tell that to our families and to our kids so that when it's time to take some of these more significant steps, like making masking optional, that they'll feel that that's because it is safer, not because a bunch of adults want them to, take an action that is related to some other agenda. So that's what I wanted to kind of convey. And I don't know how we do that precisely, but we've got to talk to the kids and engage with the kids and help them understand the risks so that they know that they're going to be safe. It's going to be okay.
It's a really good point, Councilmember Reamer. I think that moving forward, we absolutely need to address those issues. And thank you for those questions and comments. We now have Councilmember Jawanda, and then we're going to wrap up our public public health briefing and move on to our district council session. Councilmember Jawanda.
Thank you, Mr. President. Appreciate the conversation, and as always, thank you for the work that our public health team and our schools are doing. Mr. DeAndrea, my daughters happily put on their N95s this morning, issued from school, and they're quite fashionable as well. So they were very happy to have those. So I'm sure they're not alone as far as the students happy to have those. So, and just if you could remind our residents, my understanding is that those are going to be issued a pack of a week for the next couple of weeks. I don't want to misstate it, but can you just remind people what the issuance of those is going to be?
Good morning, Councilmember Jawanda. The original plan has always been to make sure that students have at least one mask per week in alignment with the county. Obviously, we give them out in sets so that they can rotate them over the course of the week and multiple weeks.
Got it. Perfect. Yeah, and it's like a pack of 5 or something like that. So to rotate them, wear them across multiple weeks and rotate them out. Okay. I'm seeing nodding, and I saw nodding from Miss Izzard as well. Okay. I think are we any update from General Counsel on while the cases are going down, that's great. Obviously there's more than 26 cases because we're not tested. We don't have a robust enough testing to know exactly how many. The guidance being updated is awesome as well, that you don't have to quarantine. So all good things, but anything on the ability to test more in the issue with the state guidance, have we made any progress on that?
So we have made progress in terms of increasing testing, albeit slowly by adding an additional vendor. And I know that there are further conversations happening with other vendors to be able to increase the amount of overall testing. In terms of the conversation about opting out versus opting in terms of parent consent, there is definitely a lot of work that's happening behind the scenes on that front. To this point, we have realized that it's been very challenging to find any vendor that is interested and would be willing to move forward with our plan of being able to, or possibility of being able to do an opt-out model. But we are looking into some additional possibilities, and we'll make sure to keep you and the other members of the council updated on that.
Okay, I appreciate that. And again, I've said this from the beginning. I think that's not. Hopefully, we are heading in the right direction. But this is long term. We need to figure this out. There will be other issues we're going to need to. So I think this is something that we need to figure out to have this capability, a tool in the toolbox for obviously potentially another variant, but also down the line. So I appreciate you still working on that. My last question, Mr. Stoddard, and I don't think I missed this, but the issue of youth sports, and attendance and masking there, I'm happy my daughter's playing youth basketball again, but I'm the only one that can go with her, and other people want to come. Could you just address that? I know you were going to be sending over some updated guidance, is my understanding, but could you address the attendance issue and the masking issue with youth sports?
Yeah, we had already begun talking about participating in rec programming, indoor spectators for youth sports. I know MCPS is looking at that same issue as well. I think MCPS has been expanding. They started at 25% capacity, have gone to 50. I think there was an intentionality to get to 100% there. I expect we're going to be having we're working through the details, because obviously different settings have different capacities, and the question ultimately becomes how you make it work in every setting. But the intention is to obviously move forward without the mask mandate next week. I do believe that we will not be having a mask mandate, that subject to some final review and discussion around county buildings or county rec or libraries, but still reviewing that. And then obviously spectators will increase thereafter. So I think that's always been the intention, is to increase as the surge came down, as we get to a better place, as we remove mask mandates. The intention was to remove other restrictions as well. Dr. Bridges and I have been actively engaging with departments to make sure that there weren't restrictions that we didn't know about. And obviously, if there were restrictions of any kind, we wanted to know about them and make sure that they still made sense, if they made sense, and try and roll back as many of those as we reasonably could. So that's the intention.
And how soon, just to press you on the timing, how soon can we expect to have a change there?
Yeah, I think you'll hear about it when we meet next week. Obviously, mask mandate will be lifted by that point. We'll be able to provide updates on any of those additional restrictions on the time.
So, Councilmember Jawanda, let me just add, we will be measured. We want to make sure there's still, even though there's a lower community transmission level, we want to be measured to make sure that we hear the responses from the community, such as recreation, and other agencies, as well as how that will look. So we're looking at not only how it will happen, but what data will impact it happening faster. So that's part of the plan. I wanted to share that as part of that update.
I appreciate it. Yeah, and we've always been measured. I think that served us well. So I appreciate that. But it's time to move in that direction, and I appreciate you acknowledging that.
And Councilmember
Jawanda,
you didn't ask about this, but since you're, obviously the library's lead, I will tell you that you'll be seeing an announcement about Sunday library hours later today.
Oh, you made my day and all of our days. So thank you for bringing that up, and that is great news as well. So just to repeat that for anyone listening, Sunday hours coming back later today. All right.
Well, we'll have an announcement later today, but let's put it this way. I'll give you a little sneak preview. It's this month that we'll be reopening libraries on Sundays. So
awesome. Thank you, Mr. President.
It's a good Valentine's Day gift. Councilmember Navarro is going to have the last word in our public health briefing. Councilmember Navarro.
Thank you, Mr. President. Very quickly, to, of course, acknowledge, because it's important to acknowledge where we are, and to thank everyone, of course, most importantly, our residents, for hanging in there and getting us to this point. Also, just want to publicly thank Council President and Chairman Rice for sending that memo requesting the endemic briefing that Councilmember Friedson and I had respectfully requested that we begin to discuss. I think a lot of the questions that have been asked today are definitely part of that exercise, and I believe that it will serve us well to begin this conversation and to begin to also in some ways memorialize how we will be operating in case, heaven forbid, there's just another spike or something else that comes along our way. So I want to thank everyone for agreeing to do this. I know everybody's so busy, but it is critical, I think, that we start to think through what the endemic stage will look like and to prepare for that. Thank you.
Thank you so much. All right. Well, thank you to all our public health officials and MCPS colleagues. We, of course, are on recess next week, so we will not be seeing you, but I know we will be in contact and communication, and we appreciate your leadership. And this morning's tribute was so poignant, and this briefing just speaks to it. So thank you all. Colleagues, we will now move on to item number 3, sitting as the district for our district council section. Item 1A is a work session and action on a zoning text amendment 2109 office and professional biohealth priority campus. Our Fed committee deliberated and recommends approval with amendments. I will turn to Chair Reamer to set this up for us and yield to him to yield to the bill co-leads and sponsors to speak to it as well. But Chairman Reamer.
Perfect. Thank you. I will share the committee's recommendation and turn it to the leads for their observations or comments as well. And I just wanted to begin with a little bit of background about our efforts on life sciences and biotech, because it's been a huge focus for the Fed committee, the Economic Development Committee. And I think this is going to be one of the signature items of this term's work on these important issues. And I'm really excited. I appreciate Councilmember Friedson taking the initiative to craft this proposal. It's a good one. And it's going to help meet a real need for us, particularly as we are in a surging investment environment, to be competitive, to offer a speed to market that can match what smaller jurisdictions do or bigger jurisdictions. And I think that's one of the cores of the issue. We've heard from a lot of private sector, leaders that the time that it takes to go from I've got a breakthrough, a scientific breakthrough, I need a lab space and I need to hire up. It's just too long in Montgomery County. It takes too long. And as a result, that company, which needs to move fast, is going to look somewhere else. So we got to solve that problem. And I think that's what this is about. And this proposal comes within context of a number of important changes that we have made to promote the density of our life science sector. We look to Massachusetts as a model for how life sciences can lead an economic renaissance. Boston is a great example of a community that has really taken off over the years thanks to its prioritization of life sciences. And we can do the same thing here. That's what we've been working towards at the committee. And we have great opportunities to get our life sciences cluster, higher on the global rankings. And that can help us compete as our economy has really faded in most other areas, I think, in this county in the face of competition from Northern Virginia. We do have a bright spot. We've got an all-star on the team, and we need to get that player in. So that's what focusing on life sciences is all about. But we've got incredible programs going with biohealth innovation. My colleagues remember the work that we did to put a partnership in place with BHI that had kind of faded, and we resuscitated that and brought it more resources. And that's an important partner for us in the Maryland Technology Council. We're working closely with them to leverage their expertise. We funded a task force on resiliency that actually went on to get a federal grant, a multi-million-dollar federal grant to help local entrepreneurs in the wake of COVID to accelerate their working. We are remaking our SBIR grants and trying to target our county resources to the better points in that process for entrepreneurs to get their companies off the ground. And we've got some of the region's best thinkers, really nationally best thinkers, working with us at MCEDC to figure out how to make more progress in the sector and tackling challenging issues, for example, like conflict of interest rules that are preventing local entrepreneurship in our powerful federal research labs. So we've taken on the development limits that were blocking future growth in Gaithersburg, and we've opened that area up for more development, and that's going to be terrific. And Councilmember Rice, we've been working on life sciences workforce partnerships with MCPS and the college and Shady Grove and WorkSource Montgomery, and we're making a lot of strides there. We've revisited and rewritten the rules to incentivize development in opportunity zones in Montgomery County, removing the impact tax cost burden on projects in our opportunity zones, which we especially hope is going to make a big difference in White Oak near FDA, where we have the opportunity to really have a strong cluster there if we can get the private sector rolling. So all of that is happening, and in this context, as I said, a ZTA that is intended to allow private investment to proceed without barrier, without needless process and endless revision, but to come into the county and get to market in a timely manner. So that's my broader frame. I'd like certainly to invite the sponsor, Mr. Friedson, to share his comments, and then we can turn it to staff to get into the specifics of the ZTA.
Yeah, thank you for that. I am proud to serve on this body and to work with colleagues in the executive branch and planning in the private sector to really make the strides that we have in bio. And really what this effort is an effort to double down on that strength, that global leadership in life sciences and industry that in Montgomery County is not just creating jobs, it's saving lives. And it's revolutionizing the way in which we live and the manner in which we can live better and healthier lives. And this CTA creates a green taping, a expedited regulatory review process for biohealth facilities of 150,000 square feet or more for new attraction efforts, and 50,000 square feet or more for expansions of our existing biohealth facilities. As colleagues noted, and I appreciate everybody's co-sponsorship, it is modeled after the Amazon efforts that the prior council put into place. And we took the thoughtful way that was handled and tried to adapt it to the needs of one of our most important strategic industries, which, to me, was, something that made sense. We didn't create a new wheel. We just repurposed a wheel that we already had for a core strength that we can build on. And really that's what our economic development efforts should focus on. We did it in a way that focuses on where our biohealth strength currently is, and also prioritized opportunity zones, equity emphasis areas, and bus rapid transit, including the CCT, which was intended in the original drafting, and we added belts and suspenders, which I appreciated. Councilmember Rice understandably had requested. And just to give a sense here, this takes a standard process that is estimated to take about 600 days in terms of regulatory review, and it cuts it down by almost 75% to about 160 days. And there's already been significant efforts by the planning department, who deserve a lot of credit for really streamlining our efforts, and this really builds upon that and takes an even more aggressive approach for this strategic industry that we have focused so much of our economic development emphasis on. And so I just wanted to thank the executive agencies, thank the planning department in particular, and council staff for all the work here. We have a great industry that we can build on, and this is one example of how this council is making sure that we are taking some of the things that we have in Montgomery County and making them even better. And so with that, we yield back to the chair and to council staff so we can go through this packet and look forward to the approval of this important measure by colleagues.
Thank you, sir. All right, so once again, the proposal creates a accelerated approval process for a project that is a new build, essentially, like a new building of, was it 150,000 square feet, Councilmember Friedson? I think that's right. Or that's for a company that is new to the county, or the expansion of an existing facility by 50,000 square feet or more. So when we have a big project, then we can be all hands on deck and meet a 60-day turnaround timeline that is market competitive. So I don't know how much council members want to go into, very specific clauses of the zoning text amendment. We can hear from planning about their ability to meet these goals, and then we can proceed to see what other council members may wish to bring up in this context. So Lavu, I'll turn it to you now, and thank you for your work on the packet, and we'll get into the details as needed.
So the brief overview is this will create a whole new use termed the Biohealth Priority Campus that will be allowed in the CR, EOF, as well as the LSC zone. And the business use must fit under life sciences, research and development, or medical, scientific, manufacturing, and production. The application requirements will be similar to that of the site plan. The planning board will have to hold a hearing within 60 to 65 days of when the application is accepted, and then reviewing agencies will have 15 days to submit comments. A few changes that were made during the committee session were, again, including CCT explicitly, adding LSC zones, and then if an applicant fails to comply with the deadlines, the application is revoked unless they request reinstatement from the planning board by showing good cause for missing that deadline. And other than that, that's the brief overview, unless council members have specific questions, and I could go through it in a more detailed fashion.
Thank you so much, Ms. Nadeau. I think what we'll do is it would be good to hear briefly from Chairman Anderson and Director Wright, just from their perspective and confirming their ability to meet this objective. And then I have Councilmember Jawanda in the queue next. So, Chairman Anderson.
Thank you. We applaud this effort to streamline the development review process for important economic development projects. We will be challenged to meet these deadlines, but we believe we're up to that challenge. We just need to manage that process, and we will be working with the council closely to make sure if there are impacts on staffing and resources that we can address those as appropriate.
Director Wright, did you want to add anything?
No, I think the chair addressed everything appropriately. Thank you.
Thank you. Councilmember Jawanda, you are in the queue next.
Thank you. Appreciate the effort here, and glad we're going to pass this CTA as a co-sponsor. I'm very supportive of it, and we had a good discussion in Fed. One of the things that has not been mentioned heretofore is the racial equity statement, which made some suggestions and had some concerns about exacerbating racial inequity because this industry, which is an all-star industry that we want to expand, is not diverse and has challenges like many of our industries because the history and legacy of discrimination in this country, as we discussed in a very thorough way this morning. And one of the suggestions that was in the racial equity statement, which I have attempted to build upon in the Fed committee, but also and then slightly modified here today, is to incentivize locating these really important industries, biohealth facilities, in areas that have been historically underinvested in communities of color. And a proxy for that in this ZTA, which I really appreciate the lead sponsors, including, is opportunity zones, which we have several here in the county. And this allows for these to be located, this expedited review, in opportunity zones, along with all the other areas, the red policy areas, the within a half mile of transit, which is a lot of the county as well, bus rapid transit as well. So it puts it on par. But when we talk about racial equity, it's not enough to put it on par. You have to go a step further to address the deep inequities that are present. And you're not going to do it with one tool, right? This is one ZTA, one tool, one effort. You're going to need to do a lot of other things, which the racial equity statement mentions. And I know colleagues have worked on, and I'm also going to be supportive of those, of giving some financial incentives for people to move into this industry. And I know there was some issue with the MOVE program. We had to pull the agenda item that was going to be introduced today, but we'll figure out a way to make sure that there are financial incentives, but we're going to have to do a whole package of things because the inequities are so systemic and so deep that every time we have an opportunity, we have to embed racial equity into every proposal in a deep and meaningful way. And so what I proposed in committee was to take a tiered process of having it to be 90 days down from 120 for every other area and 60 days for opportunity zones. There were some concerns raised. We had a good discussion about, well, we want to go down even further to get competitive with other jurisdictions. So definitely heard that. And as is in the packet, have worked with staff and others. I want to thank Ms. Nadeau and others for helping with this and doing some research to keep it at 60 days for everywhere in the ZTA that it already says, but for opportunity zones, go to 45 days. And again, we don't have that many, but they are, one of the good and bad things about segregation is that these are compact areas and we know where they are. And it's the maps that we're all familiar with. And this would bring it down to 45 days within an opportunity zone and still keep the baseline of 60 in the amendment and not change that in the overall ZTA. And this could further incentivize biohealth facilities to locate in these opportunity zones while still keeping the 60-day process everywhere else. And if you look at neighboring jurisdictions, last thing I'll say on this amendment, and I'm proposing this amendment, is if you look at neighbors in Frederick County, their normal process is 90 days, but they have a 45-day, same as I'm proposing, expedited process. If you look at DC, they have a standard 7-week, 49-day approval process. And so I think given the size of these areas and that it won't be a lot of them, but it will create an additional incentive to locate in a opportunity zone. And I think it's very doable. So for all those reasons, I'd like to recommend to colleagues and move that we keep the baseline 60 days, but for opportunity zones, move it down to 45 days. And Ms. Ledoux has the language in the packet that would be needed to accomplish that.
Before the formal amendment, which in the motion, Councilmember Jawanda, before we get to that, there's a couple more comments just on background.
Sure.
Sure. The amendment, and then after those comments on background, then absolutely that motion will apply, and we'll seek a second for that motion. But I know Councilmember Friedson also wanted to talk more broadly about some of that background and context within the discussion. So Councilmember Friedson, I yield to you, and then Chairman Reamer, and then after those two comments, we will then formally have the motion on the floor. Councilmember Friedson.
Thank you, Mr. President. Thank you, Councilmember Jawanda. I really appreciate it. We had a really good discussion in committee on this, and I appreciate this refined amendment that is put forward. I had been working with Councilmember Navarro and Councilmember Jawanda just noted, and many, I believe, perhaps all colleagues are going to be co-sponsoring financial incentive to try to attract additional investment and opportunity zones, specifically in this key industry, and there's tremendous opportunity in some of those opportunity zones. Obviously, White Oak comes to mind for all of us, but there are others throughout the county as well, where there's real opportunity here, and I do think that we need to invest in those communities and partner with the private sector to incentivize them to invest in those areas and those communities. I think that those financial incentives are the best and would be the most effective way for us to drive investment into those areas, and then have a macro level regulatory review process that is the same for everybody, and then target with additional incentives in areas where we think it would be most beneficial for these to locate, where we have other priorities, important critical priorities for investment to take place. And so that is the general approach that we had taken. As noted, the incentive which we were going to put forward today, there was a note from council staff and MCEDC that there's a technical tweak that we need to address, and so we wanted to address that before putting it forward, which we will be doing in short order, and so that will be moving forward as well. I just thought it might be helpful. We took a very aggressive approach here. We had some concern and resistance, and then ultimate consensus from planning staff and executive agencies on what is actually doable and what could be done. We reduced this process by 75%. And so perhaps it would be helpful, Councilmember Jawanda noted, I think helpfully, some other jurisdictions, neighboring jurisdictions that have certain processes. So perhaps, Mr. President, if it would be okay with you, if we could hear briefly from planning and or the executive agencies that would be involved in this, what their belief is of whether or not the 45-day window would be doable and able to be completed within that time frame.
So we'll do that, and then I've got Councilmember Navarro and then Councilmember Hucker in the queue next. So Chairman Anderson or Director Wright.
We had spoken during the work sessions on this that 60 days is very aggressive. I think the council needs to understand that whatever number of days we're talking about, it's actually 10 less, because we do believe we still need to give appropriate public notice for any of our items. So 60 days is really 50 days. 45 days would really be 35 days for review. We definitely do not recommend decreasing the number of days for public notice, because we think that's really, really important. We have again, I can't speak to what Frederick's process is, but we have constituents who are very concerned about traffic and about environmental concerns for every development that comes in. And we do require developments to provide us with very detailed traffic information and stormwater management information
And those kinds of technical reports take time to analyze. They are not simple. And so, again, I want to just be very clear that the work that is done in development review is not intended to be nitpicking or second bites of the apple or sending things back and forth for not a good reason. But we, again, have made a commitment to our residents to really thoroughly look at some very, very technical issues, and we need time to do that. 60 days will be challenging, but we'll do our best. I think 45 days would be more than challenging.
Thank you for that. I've got Councilmember Navarro, followed by Councilmember Hucker, then Council Vice President Glass, and then Councilmember Jawanda again. Councilmember Navarro.
Thank you, Council President Albornoz. So, you know, I did want to just chime in quickly about how important, you know, the racial equity and social justice impact statements are. I mean, after all, I'm the one who authored the legislation and felt that this was critical. And they are meant to make sure that there could be flags that give the decision makers an ability to figure out how can we address these issues. But it's also important to put them in context. And I think that, you know, here we are balancing a number of policy priorities. I mean, we are quick to criticize the planning department and staff in terms of perhaps not having enough public participation. Yet we tend to then want to propose even our shorter window, which will then affect that notice and that input and participation. So it's just such a delicate balance, and I appreciate that very much. So to me, I think that making sure that we are not setting up a situation where it is so restrictive that then nothing moves forward, especially in areas like the East County with Vigo, White Oak, and things of that nature, which is top of mind in terms of racial equity issues. I think that providing, you know, an incentive is another very tangible way to address some of those issues while pushing the envelope a bit. I mean, this is pushing the envelope, believe it or not, for us. And then perhaps reevaluating and see how it's going. But it is going to be difficult, I think, to balance all of this. And I just wouldn't want to set ourselves up for more barriers because we have such good intentions to, you know, push the limit even further. So anyway, I just wanted to make that comment. And obviously this is, you know, the main reason why I thought that working towards some kind of incentive program, you know, grants, etc., would be the best way. And I look forward to ironing out whatever wrinkles we have there, because to me, you know, this will spark a lot of interest on folks who are people of color in this space, knowing that we are actually putting money on the table to make, you know, to invite them over. So anyway, just wanted to make that comment and reflect on the, you know, fact that this is why I won't be able to support Councilmember Jawanda's proposal, but it is because, you know, what we have heard from the folks that are going to have to administer this, as well as making sure that the public still has that period of time that is necessary for notice. I think that might work against our intended goals instead. Thank you.
Thank you. And this is my fault. Councilmember Reamer was in the queue. Chairman Reamer was in the queue, so he is next, followed by Councilmember Hucker, then Council Vice President Glass.
Thank you. I was just trying to say that maybe we can find a way here. You know, I am somewhat, you know, I think there's a principle and there's a practicality. And I think that I'm skeptical that applicants would say that it's so important to be at 45 days versus 60. I think what's crucial is being really certain and being fast. I think perhaps there's an allowance, you know, perhaps we can allow them to request 45 days. I hear what Ms. Wright is saying about, you know, especially the stormwater. I think it was my proposal. I don't think we subject these projects to transportation tests now through the GRIP. I think we removed that requirement. And so, frankly, it's, that's an element that isn't part of this, if I'm recalling correctly. And it could lend itself to, it does lend itself to a much more expedited review. So I'm not sure I see the harm in allowing 45 days, but I understand that the entity that has to deal with that is really planning. And, they have certain capabilities. And in order to line everything up to achieve a 45-day timeline, they would have to do things even more differently than they're contemplating doing things now. But I also think that this will not be common. It hasn't been common enough. We'd like to see, we wish it were common, but we know that it's more unusual. With the exception of downtown Silver Spring, where we have a biotech behemoth that is maybe could take advantage of some of this. It won't be every day. So perhaps it's viable. I guess Germantown, that opportunity zone is also benefiting substantially, and there are projects there with Montgomery College campus. So to Chair Anderson, can you find a practical solution here?
I understand. I can totally appreciate the desire to give an edge to these areas. I would suggest an alternative to compressing the time frame, which is already very tight under this bill, rather than trying to further tighten the time frame, which we are really concerned that we cannot meet a tighter time frame. It's going to be hard enough at 60 days, as Gwen has said. However, if you want to give another edge to these projects, there's other ways to do that. For example, you could tell us to waive the fees for those opportunity zone projects for biohealth. That will have budget impact. You would have to backfill that. It wouldn't be, I don't think, an enormous amount of money, but if you're trying to give an additional incentive, it's possible to give a little bit of an economic incentive as opposed to telling us, speed up the treadmill, right? That's another alternative I'd offer up.
And that's not inconsequential, right? Doesn't it cost a couple $100,000 to submit a sketch plan and so forth?
It depends.
Yes, it is a substantial amount of money. It can be hundreds of thousands of dollars. For a project that's 150,000 square feet or larger, it can be hundreds of thousands of dollars.
Or you could have
be money well spent, I think, by the county, to offset that expense.
Or if you decided that was too much, you could give them a 50% fee waiver. So I'm just saying there's ways to do this if you wanted to give a little bit of an edge to projects in certain areas without further squeezing us on the time frame, which is already going to be very challenging. So we just urge you to find another incentive if you're looking for an additional one, rather than pushing us beyond the breaking point.
I see Councilmember Friedson has hand up, I assume, and looks like about this specifically. Councilmember Fried and Councilmember Jawanda as well. Councilmember Friedson.
Yeah, I appreciate this. So, the first question is whether or not we think financial incentives are the best approach to address these issues or not. That was precisely the proposal that Councilmember Navarro and I were putting forward. That was that thought process, that approach. And when we put that forward, the thought was this wasn't the only way we were going to need to incentivize this. And so I think it's helpful for planning. I prefer it if it weren't now, if it was previous, but to think through those ideas. I think the application fee, a discount on the application fee, is a very important proposal. I think it would be additive to the grant proposal that we had discussed. So I would, personally, we can't do that through a zoning text amendment. That it's not really, directly relevant from a legislative procedure to this. I don't believe we could set the application fees here, but maybe the legislative attorney, maybe Ms. Nadeau, can clarify that. And perhaps it would be helpful for planning to come up with some proposals for us of what a standard application fee would be for projects like these, and what a full discount of 100%, a 25%, a 50%, a 75% discount, so we could understand it for a subsequent introduction. I'd be interested in putting that forward at the appropriate time, but maybe the legislative attorney, Ms. Nadeau, could share with us whether the application fee question is something that would be or could be included in this zoning text amendment.
Yeah, I'll just note, I agree because it's a technical question. We need a technical response, which is critically important. I do want to be respectful of my colleagues who are in the queue, but I am going to ask Ms. Madhu to respond to the technical aspect of this conversation so we don't go too far down this rabbit hole. Are we permitted to adjust fees within a ZTA?
No.
Thank you. So just from a legal perspective, it's a good idea, but would need to be done in a separate setting. Councilmember Jawanda.
Thank you. I appreciate that answer. I guess it would need to be legislation, Ms. Nadeau. Okay. Could you just say yes for the visually impaired?
Yes.
Okay. And certainly we'll want to work on, I think that's a good idea. I guess to Mr. Anderson's point and Ms. Wright's point, just on this issue, the allowing, we have 14 census tracts that are in the county that are opportunity zones. So to Councilmember Reamer's point, this is not a large swath of the county. And I think this would be a very innovative strategy. I'm not aware of anyone who has used the land use in this way in a racial equity sense to shorten timelines for racial equity purposes. So I actually think it's an innovative approach. I initially proposed 60 and 90 days to address planning's concerns about the staff capacity. But I do think in this sense, since Frederick's doing 45, DC does 49, and it's going to be a small group, and to Councilmember Reamer's point, we can waive, there's certain things that aren't included in it. Maybe having an allow the folks to request 45 as opposed to automatically doing it, that would seem to lessen what I already think would presumably be not a large burden already. So, but sensitive to the issue, but I think that's an elegant way of trying to address it. So when we get to the motion part, I'd be willing to amend that in light of Mr. Reamer's point to try to find some, yet again, a third crack at consensus here.
Okay.
So thank you.
Councilmember Hucker, followed by Council Vice President Glass.
Thank you, Mr. President. I know we've sort of, I think, morphed a little bit from the bill to the amendment. So I just want to say on the front end, I'm grateful to Councilmember Friedson, excited to see these opportunities focused, especially on Down County and East County. I think Silver Spring in particular doesn't get enough attention. I rarely hear it discussed as a biohealth hub, but I really think it needs to be. It's of course been one of our very important businesses there has been doing much of the heavy lifting in the global biohealth arena for quite a while. And East County has tremendous unrealized potential because it's one of the last remaining areas in Montgomery County with relatively affordable land outside the ag reserve, which is off the table for this. Businesses continue to tell us that unnecessary delays and time-consuming processes are usually the reason that they choose somewhere else to establish themselves and invest money and create jobs rather than Montgomery County. And so I'm glad we're having this discussion, and we need many more to focus on that. On the amendment, I really agree with everything Councilmember Navarro said about the balance between public input and expediting review and creating jobs. But I feel a little bit challenged by the idea that like DC and Frederick County are doing things we aren't doing. And I think we should be asking ourselves why that is. So if planning needs more staff, I feel like we should talk about that. If they need a rebalancing of priorities to focus on expediting review that puts family providing living wage jobs in our opportunity zones, that's a great discussion to have. I'll show up early for that discussion. But we're in a historic economic recession. I would just want to see the council lean in on figuring out ways to knock down the barriers and make something like this happen rather than prolonging the pain and extending our competitive disadvantages relative to other regions. And I do like Councilmember Reamer's suggestion about allowing them to request exceptions rather than putting all applicants under the same timeline necessarily. I can't imagine there will be many of these, and I would love to have that problem and come back to another discussion where we're talking about, geez, how do we deal with all the applicants for biohealth campuses in Montgomery County. That would be a fun discussion to have, and we can adjust the budget accordingly. Thank you, Mr. President.
Thank you. Council Vice President Glass.
Thank you, Mr. President. I, at the onset, want to extend my appreciation to Councilmember Friedson for the legislation, and proud to be an original co-sponsor. And I have to associate myself with everything that Chair Reamer and Councilmember Hucker just said. I understand the policy goal, particularly of the amendment, and I think it is absolutely laudable and has merit. But when the agency charged with doing this work is sharing with us that they don't think that they can do it under that timeline, then we have to figure out why that is. And I think that only highlights the need for additional reform. We're talking about regional competitiveness. We're talking about Frederick. We're talking about DC. We're talking about other areas. And I have concerns that if the only way we can deal with regional competitiveness is to continue giving money out to incentivize and make up for other shortcomings in our processes, well, let's change our processes. Let's reform our processes. Let's cut some red tape. Let's make the review times faster, as we're talking about now. And that's what we need to do. I'd rather get to the root cause of these issues than continue to Band-Aid over them by giving more money out and cutting other impediments to people wanting to create these types of businesses here. Let's dig down into that conversation. Let's use this legislation and this conversation we're having right now as a vehicle to continue moving forward. So clearly I support the legislation, and as it relates to the amendment, and we'll see if Councilmember Jawanda wants to further amend it. I support the goal, but not sure how workable it is if the agency is telling us it's not workable from their vantage point. So let's all work together to figure out what is workable to make sure that our review processes are faster, that we can do the things that we want to do, that we need to do for our own local economy. And I'll wait for the further conversation about the particular amendment. So I yield back. Thank you.
Thank you, Council Vice President Glass. Because we are once again talking about technical and administration here, I am going to give Director Wright the opportunity to comment, just and elaborate on staff capacity and what it would take to expedite this moving forward, seeing that there's consensus, and I know within the planning staff wanting to move things forward as quickly as possible too, but within reason, clearly. So Director Wright, just your response to that, what would it take? And this is the broader conversation. We're about to get our operating budget soon.
I think it's a broad conversation on many levels. The council may or may not know that many of our development laws and regulations are much, much more tight and have greater restrictions and requirements than some of our adjacent counties. We have probably some of the strictest stormwater management laws and forest conservation laws and other kinds of legislation in the entire state of Maryland. We continue to try to refine those laws and make them even better. And I think that there is a balance as we add more very, very important and laudable policies and laws regarding many things, whether, and again, I don't want to only focus on the environment. I want to also really talk about restrictions and suggestions and laws and policies that we have about how to mitigate building height that is adjacent to other communities, which is an issue in places like Silver Spring and Bethesda, where we're trying to get more biohealth things going, where we have restrictions and laws about how we handle what you can put underground in the public right-of-way versus what you have to put under your building. We have just a slew of, again, very, very complex laws, policies, regulations that have been approved. So when we go through the development review process, it's both a technical review, but it is a review of all of these different types of goals that the council has set forward in the form of ZTAs and code changes. And a lot of times we have to think very creatively about how to both accomplish the goals of the applicant and meet the greater public goals that have been laid out for things like environment, for forest, for walkability, for stormwater management. You know, it's for compatibility with adjacent communities. I mean, it's a very, very challenging jigsaw puzzle, which I have to tell you may not be the same as some of the more greenfields types of development that may be occurring in places like Frederick. So, you know, and we, you know, do take very seriously the idea that there has to be a balance between moving projects through quickly and efficiently, while also remembering that our residents are also our constituents and they need to have pre-application meetings to understand what the project is that's coming into their community. They need to have notice. They need to be able to participate in our development review committee meetings, and we've been doing lots of important things to increase that participation. It is a true balance. And we just have to say, even if we had a lot more staff, I don't know that we would be able to get to that balance in 45 days. What might happen is that we would review projects that would be heavily conditioned. That is, we would say it's approved, but you have to work out your stormwater management with DPS after the board approval. You have to work out your access permit with SHA after the planning board approval. And so there would be a great deal of additional time at the far end after the board, because we would have to take some of the more thorny, difficult issues and push it off. So I don't know if others on our team have anything they want to say. I also know that Victor Salazar from Department of Permitting Services is here. We have had meetings with Department of Permitting Services to talk about how to make the 60 days work. But I'm guessing, although I don't want to speak for Victor, that they would also be somewhat challenged with the 45 days.
Let's hear from Victor. Then I know Councilmember Katz has requested to be in the queue broadly, and then I'm going to go back to Councilmember Jawanda to make a specific motion again. Mr. Salazar, please go ahead.
I'm just going to echo everything that the sentiments of Gwen. It will be a challenge for DPS, and we are having discussions, as she alluded to, talking about the technical aspects of how we were going to accomplish this. But you know, we are supportive of this endeavor, but we are just you know, just trying to figure out how we're going to make it happen. So whatever you guys decide, we will just put our heads together and try to figure it out.
Thank you. Councilmember Katz, and then I'll go back to Councilmember Jawanda regarding his motion. Councilmember Katz.
Thank you very much, Mr. President. I believe, and so much has already been said about what I was going to say, but I believe that the public discussions are extremely important. It certainly, we need to keep them involved. And we should and will keep them involved. Stormwater management, those discussions are important. Transportation issues are important. The fact that we are, with this legislation as it exists, to Councilmember Friedson's point, to be 75% better, that's a tremendous, that's a tremendous step.
Councilmember,
And then just for us to then say, but you could say 15 days. I don't know how many places that are looking to build 150,000 square feet or 50,000 as an addition, that 15 days is going to make that much of a difference to them when they're dealing in those types of issues. I think we should figure out what we can do with the 60 days. I think that we're going to have challenges to do that, but we need to figure out with those challenges how we can do it. If we can get there and we find that there is need for additional time or less time, then that's something to consider. But the other thing that we have to do is we have to look at our competition, as we've said time and time again. And if their competition, as much as we don't like financial incentives, if that's what they're given, then we need to do better. We need to do better than they are. If there's a competition on the waiving of fees, then let's consider that. But that is a broader discussion than today's. I believe that we cannot bite off more than we can chew. And I think it's going to be very tough on us to have the 60 days. And it is imperative that our public remain involved. So thank you very much, Mr. President.
Thank you, Councilmember Jawanda. I yield back to you to amend or make your motion, and then we'll see if there's a second. We'll have a formal discussion on the amendment itself. Councilmember Jawanda.
Got it. I appreciate that. Again, I just wanted, the first compromise was 60-90. I think the principle is really, really important here. I think in everything we do, we have to address the racial equity and disparities, particularly in an industry like this. And I think it's an innovative way to use it with the regulatory approval process. Again, I'm supportive of the underlying bill. We all are. But this is an important detail and, in component of it. And so whether I had initially proposed 90, which would have taken it down from 120, which it is today, to 90 to recognize planning's concerns, and then 60 in opportunity zones. If we did, you could do any combination. You could do 75, take it down from 120, and do 60 in opportunity zones. I just think the principle of having it targeted in opportunity zones is important. You could do what Councilmember Reamer proposed, which I'm going to, I think, officially move to get us down to Frederick in DC, and do 45 in opportunity zones and 60 across the board. And I understand planning's concerns. That's a larger issue that we need to address. And if there do need to be more staff and resources, or if we need to adjust the process further, we should. But I think, again, these are 14 census tracts. I hope White Oak in Germantown, and I hope we get a ton of these requests. And that, again, that would be a good problem to have. I guess one of the questions I was going to ask is, how many of these do we have pending right now before I make my motion? This is the planning.
Well, I can tell you we've had quite a few biotech projects of late, and that we had provided this information. We did a quick check of the last year or so. We've probably had 7 or 8, and
in opportunity zones, Ms. Wright. In opportunity zones,
days.
In opportunity zones, you've had 7 or 8, or countywide.
Mm-hmm. I'm sorry, I couldn't hear Councilmember Jawanda. If you had another question,
can you hear me now? Can you all hear me? Yeah, I was saying, is it 7 or 8 in opportunity zones or countywide?
I would have to go back and look at that number. They definitely are in Great Seneca Science Corridor, in Silver Spring, which I believe Silver Spring is an opportunity zone, if I'm not mistaken. I would need to go back and look at the map. I can't tell you that offhand.
Some are, some aren't, probably. Okay. All right. Well, I'd like to again, I think it's really important to do this in principle here and in practice. And to Councilmember Katz's point, 15 days. Every development I talk to, it's, if you don't do it tomorrow, it's costing money. So I think that, and again, no harm, if they don't come in and request it, then the staff capacity issue is not an issue. I just think, like, it can't be both, all things. So it's got to be one or the other. It's either got to be a problem, or it's not, or it's going to be a good problem to have. but we have to enshrine this principle, I think, in everything we do. So I'd like to adjust my initial motion to be a opt-in. We've used that term a lot, and Ms. Nadeau, I think, has the language here. It would say, if located in an opportunity zone, applicant may request the planning board schedule a hearing within 45 days. So that would be the actual language, and I would move that officially.
Second.
It's moved by Councilmember Jawanda, seconded by Councilmember Reamer. We're going to open up discussion. I do have something to say about this. Was there anybody in the queue for the discussion? Okay, let me just say a couple of things. I certainly understand and respect the intent of Councilmember Jawanda. I really appreciate that, but I think we really need to dig down into what Director Wright said here. It's not more staff alone that's going to get us to be able to expedite. With the best of intentions, this and previous councils have added a number of benchmarks that addressing climate issues, addressing stormwater management issues, we have been intentional about so that we are cautious in our approach. And it's those layers that I know, speaking for myself, I often hear about from our community, our business and our development community, are the reason why it takes as long as it does. And I know a thing or two about unfunded mandates as being in the executive branch for 12 years. And I know it just ends up frustrating everybody around you because you are put in a position to fail. And you set expectations that can't be met by the staff. It then reflects poorly on the staff. It reflects poorly on the county even further. And we already have our foot down on the gas in a way that is really unprecedented down to the 60 days. And so I take very much to heart the concerns that have been raised by the agency who's going to be the most responsible for actually carrying this out in telling us that we need to have a broader conversation about all of these issues, as was noted by many of my colleagues, but we don't want to put our staff in a position to fail. I understand the symbolism, but I think there are other ways, as have been noted, that we can address this in a way that actually will be more effective. I want to follow up and see how we can eliminate the fees for opportunity zones. If that can't be done through a ZTA, then it should be done legislatively as another incentive. I appreciate the efforts of Councilmember Friedson and Councilmember Navarro and the Fed Committee, who unanimously has supported another approach to addressing this issue. But symbolism is important, no question about it. And addressing the underlying issues of racial equity there's nothing more important. I just don't think this solution, because it would be symbolic if staff can't comply, is actually going to help. I think it may end up creating more problems than we're trying to solve. So I don't support this amendment for those reasons, but I certainly understand and respect the direction it's coming from and will gladly support legislation that looks at things like eliminating fees within those opportunity zones. But I just feel on the whole, and when you take all of this together, that's where I come down. And I do suggest, Chairman Reamer, that we have a follow-up conversation with planning staff on this broader issue of looking at those areas and how we can expedite even further, which I know the committee has done a great job for a number of years in working to address. So those are my thoughts and reflections and where I come down on this for now. Councilmember Friedson, followed by Councilmember Jawanda.
Oh, no, thank you. If I could be in the queue after we discarded the amendment.
Okay.
For the roll call vote, but I've shared my views on this. Appreciate the rationale behind it. I think there are other ways to address it. I am concerned about setting unrealistic expectations and then setting ourselves up for failure. I think that could do more harm than good on our efforts to really focus on areas that have lacked investment. I think there are other ways and mechanisms to do it. And we proposed one. There are many more, one of which was discussed today, and I look forward to those conversations.
Got it. Councilmember Jawanda.
Thank you. Thank you. I just want to make sure, to your comments, Council President, it's not symbolic. I think it's an effort to be very substantive and meaningful. And again, if 60 is the magic number, again, the original amendment was to try to recognize it in a 60-90. We could move the days, but to say that, it's unreasonable because specific number won't work. The principle is important, and it should. And I think this is a way to address it. Again, I was very open to adjusting the numbers. There was not a willingness to do that. If planning staff cannot make 60 happen for every opportunity zone, or which they're going to have to, or if they can't make, to go to 90 or 75, I just think it's important to enshrine it as a practicality and as a principle. But just wanted to address that and appreciate the opportunity to come back.
No, I appreciate the clarification. And you said symbolism. That's why I said symbolism. But it is more than that. And so you're absolutely right about that. And I agree that it needs to be so much more. And I appreciate, again, the intent from which this motion was made. But I just go back to, we heard very clearly, 60 is going to be tough as it is, 45 even worse. And I'll note one last thing. I, on the behalf of my colleagues, just recently sent a memo to our colleagues in the Park and Planning Commission regarding concerns that had been raised in a previous conversation about transparency and about access. And we can't, it's important to put them in the best position to succeed, acknowledging, as they have, and all of us have, the importance of transparency in these projects. And people don't always agree with them, and we need to give them the appropriate lane to provide those comments and feedback. So we've discussed this a lot. I thank you all very much. There is a motion on the floor that just has been seconded by Councilmember Reamer. All those in favor of the motion, please raise your hands. That is Council Members Glass, Hucker, Jawanda, and Reamer in favor. All those opposed? That is Councilmember Katz, Friedson, and Navarro. Councilmember Rice, are you able to?
Yes, Mr. President. I'm actually in the opposed at this point. I actually wanted to say something beforehand. That's why my hand was raised, but that's okay.
I apologize. I didn't see that,
right.
that note. Thank you.
That's all right.
So Councilmember Rice is opposed to the motion as well. The motion fails 3-6. 4-6, 4-5, excuse me, 4-5. Councilmember Friedson.
If I just want to yield to Councilmember Rice if he still wanted to say something, Mr. President, if that is appropriate.
Well, thank you, Councilmember Friedson, and thank you, Council President. Look, from my perspective, there's still a lot of questions, and I agree with Councilmember Jawanda in principle in terms of what it is he needs to do. There's no question about prioritizing these areas that are opportunity zones. I do just want to remind folks that even those areas that aren't opportunity zones still need to be prioritized. Biohealth is something that we're doing a lot of work in trying to make sure that is diversified. And a lot of our work that's happening with Montgomery College in terms of building that workforce are things that we are trying to do. So it's not just about the location of that area that will benefit those residents who we're trying to target. And so from that standpoint, I think that, again, while there are incentivizations that are necessary, I think that working with us from a financial perspective, as well as working with some of the other things that we know are going to continue to benefit our community as a whole, is where we want to go. So from that standpoint, because there are still questions about whether or not something like this could be done, is the only reason why I did not support moving forward to the to the reduced time frame. I do think, however, that we need to move forward as quickly as possible with the incentivization procedures so that we can ensure that some of these things move quickly. So from that standpoint, I just wanted to be on record in terms of where I stand there, and look forward to following the lead of Councilmember Jawanda and others who are focused on making sure that we can give priority to these opportunity zones throughout the town. Thank you, Mr. President.
Thank you, Councilmember Friedson. And colleagues, yeah, just a quick time check, because obviously we're close to 12:30 here. The next item won't take as long, that's my understanding, and then the consent calendar should be fairly quick. We are going to start our brown bag lunch at 12:45 rather than 12:30, so that we can accommodate. But Councilmember Friedson.
Yeah, thank you. The next item is really a technical part of this, an SRA related. So I very much hope that it won't take very long to approve as well. But we had a really good conversation today. I just didn't want to lose sight of the consensus, because there is consensus here on this council. Everybody has been in support of this effort. There were a few details that we were working out, but the bottom line is we want Montgomery County to be the best place in the world to start, invest, and grow life-saving and life-altering businesses. And our biohealth innovation industry is at the cutting edge. I mean, you think about places like American Gene Technologies, which is poised to cure AIDS and HIV and have an operating system that changes the way that medicine and treatments happen for all kinds of diseases. You think about places like United Therapeutics, as Councilmember Hucker noted before, that is developing personalized lungs from pigs for transplants, that is doing the most important transplant research and innovation anywhere in the world. There are USA Today and New York Times and international newspapers that are covering the research and innovation that are happening here. You think about Novavax and what they're doing with the vaccine for this particular pandemic that we're in now. And I am sure that the next pandemic, through the Global Pandemic Center that we all have worked on with the executive branch, we're going to be addressing it here in Montgomery County forever for the future. And so this is part of that effort. This isn't the beginning of our conversation. The reason why we have a great biohealth industry is because of decisions that were made before. But if we rest on our laurels, that won't continue. And so this is about being intentional, doubling down on these efforts. And I just really want to thank colleagues again for the overwhelming support that we're doing here, the many efforts that we have undertaken to grow this industry, and also to council staff, to planning staff, to all of the executive agencies. This really has been an all hands on deck collaborative effort. It's complicated, but it is critical. And it is going to be really important so that these organizations who have choices of where they locate can focus on the research and innovation and technology, and not on the more than needed, more than absolutely necessary regulatory environment and red tape. So I really appreciate it. I think this is going to be a watershed moment for our biohealth industry, and I'm really proud of the work of this council and our partnership with planning, the executive branch, and so many other stakeholders. So I look forward to the roll call vote, Mr. President.
Thank you, Councilmember Friedson. Ms. Nadeau, was there anything else in the packet on this before we go to the roll call?
No, there was not, Council President.
Great. Madam Clerk, could you please call the roll?
Mr. Friedson?
Yes.
Mr. Friedson votes yes. Mr. Jawanda?
Yes.
Mr. Jawanda votes yes. Mr. Reamer?
Yes.
Mr. Reamer votes yes. Ms. Navarro?
Yes.
Ms. Navarro votes yes. Mr. Rice?
Yes.
Mr. Rice votes yes. Mr. Katz?
Yes.
Mr. Katz votes yes. Mr. Hucker?
Yes.
Mr. Hucker votes yes. Mr. Glass?
Yes.
Mr. Glass votes yes. And Mr. Albornoz?
Yes.
Mr. Albornoz votes yes.
Let the record show that that passed unanimously. We now move on to item B, which is a technical issue. This is a subdivision regulation amendment to SRA 2102, Administrative Subdivision, Biohealth Priority Campus. Chairman Reamer, I'll turn to you, and then Ms. Nadeau to frame this quickly.
This is just to implement what we just approved. So doesn't need Ms. Nadeau, I'll let you do any explaining that must be done. But it is written to be consistent with what we've just adopted in the zoning text amendment.
So what this SRA does, so Biohealth Priority Campus may want to take advantage of the subdivision process now that the regulatory approval process has been shortened by ZTA 2109. What this will do is it'll make a Biohealth Priority Campus go through the administrative subdivision process rather than the preliminary plan process. It's 90-day review instead of 120 days, so the two procedures can run parallel.
I don't see any discussion here, so this is also a roll call vote. So if we could please call the, Councilmember Friedson, you want to say something?
No, I was
okay, got it.
Roll call vote. I'm sorry, trying to speed things along.
Madam Clerk, could you please call the roll?
Mr. Friedson?
Yes.
Mr. Friedson votes yes. Mr. Jawanda?
Yes.
Mr. Jawanda votes yes. Mr. Reamer?
Yes.
Mr. Reamer votes yes. Ms. Navarro?
Yes.
Ms. Navarro votes yes. Mr. Rice?
Yes.
Mr. Rice votes yes. Mr. Katz?
Yes.
Mr. Katz votes yes. Mr. Hucker?
Yes.
Mr. Hucker votes yes. Mr. Glass?
Yes.
Mr. Glass votes yes. Mr. Albornoz?
Yes.
Mr. Albornoz votes yes.
Let the record show that passed unanimously as well. Thank you, colleagues. This is exciting, and I know Councilmember Friedson will be making more formal announcements about this tomorrow, or a public meeting, and we'll hear more about that soon. But this is important to move forward. We now move on to our last two items before our lunch recess, and the first is an action item. This is item number 4 on the appointment to the Board of Appeals to Mr. Roberto Pinero. We had some outstanding candidates, as we normally do this time around, and we were just so impressed and so appreciative of Mr. Pinero's willingness to step forward. I know that we'd like to, I'm going to defer to my colleague, Councilmember Navarro, to make this motion.
I'm honored to nominate Mr. Roberto Pinero as a member of the Montgomery County, Maryland Board of Appeals. Mr. Pinero brings a wealth of professional experience related to housing policy to this appointment, but he has also dedicated his life to serving our most diverse communities throughout the county on a volunteer basis. He has served as chairman of the Interagency Commission on Homelessness, Montgomery County Housing Commissioner and previous chairman of HOC, member of the board of directors of the Town Center Apartments of Rockville, a senior low-income development, MCPS Commission, and also the Commission on Children and Youth, among others. I have no doubt, given his wealth of experience, that he would be a great asset to the Board of Appeals. So it is my honor to nominate Mr. Pinero.
Thank you. I see a second from Councilmember Hucker. Confirming, Councilmember Hucker? Yes. Terrific. All those in favor of this appointment, please raise your hands. And that is unanimous. Congratulations, Mr. Pinero. Thank you so much for your service. We look forward to your service on the Board of Appeals. And that takes us to the last item before recess, and that is the consent calendar. Can I get a motion to accept the consent calendar?
So moved.
Second. Moved by Councilmember Reamer, seconded by Councilmember Rice. All those in favor of approval of the consent calendar, please raise your hands. And that is also unanimous. Thank you all so much, colleagues. We will now adjourn and reconvene at 12:45 for our brown bag lunch. And I believe IT staff, please confirm it's the same link that we're on right now. Is that correct?
That is correct.
Great. So just if you want to turn off your cameras and your mics and come back, or just come back to the same link. We'll see you in 15 minutes.
Just to help my parents pay for groceries, or being the first one to always step up. No, that's something you just can't put on paper. Look beyond the resume and discover new ways to develop great talent that is dedicated, hardworking, and determined.
Good afternoon, everyone. I am Montgomery County Council President Gabe Albornoz, and welcome. The council this afternoon will receive testimony on the FY23 capital budget and FY23 through 28 capital improvements program for county government. Montgomery County Public Schools, Montgomery College, the MNC PPC, the Washington Suburban Sanitary Commission, the Washington Suburban Transit Commission, the Revenue Authority, the Housing Opportunities Commission, and municipality and state projects. Projects in the 6-year program include facilities for parks, recreation, roads, schools, community college, libraries, fire stations, mass transit, housing, police, correction and rehabilitation, general government, and other public purposes. Capital projects are primarily funded with money from future issuance of bonds. Additions, deletions, or modifications to the CIP and capital budget may be made subsequent to the public hearings. Council action on the WSSC CIP is also an update to the Comprehensive Water Supply and Sewage Systems Plan. Just a quick announcement, each individual will have 2 minutes to speak. Individuals will be alerted as they approach their 2 minutes and may be disconnected. Also, we apologize in advance for any technical glitches, but we have a pretty amazing IT team who stands ready to address those should they arise. So thank you all. This is the third of our CIP public hearings, and we look forward to this afternoon's testimony. Ms. Salou, I turn it over to you to facilitate the conversation.
Thank you, Mr. Council President. Good afternoon, everybody. Our first speaker for this afternoon is Barney Rush. Barney, you have 2 minutes for your testimony, and you may begin when you're ready.
Unmute and start my video. Okay. President Albornoz and County Council members, thank you very much for this opportunity to speak today. I wish to discuss the funding of the Parks Creation Project as part of the Farm Women's Market redevelopment in Bethesda. 6 years ago, residents from 25 communities and associations in and around Bethesda came together to support the creation of additional open green space in our rapidly urbanizing downtown. Thousands of signatures were collected on a petition calling for more parks. We remain thankful to the council of that year for incorporating our vision into the final wording of the new plan. Several council members here today were on that council. Now is the time to turn this vision into reality. Progress has been made. The developers, the Bernstein Management Corporation and EYA, have developed a sketch plan that has been enthusiastically endorsed by the communities. The new underground garage would replace most of the existing surface parking, and approximately 2.5 acres of new urban parkland will be created. After the hiatus of the pandemic, the developers are ready to undertake the pre-construction work and launch this project. But the predicate for this is a credible financial plan committed to by the parties. Some of the funding will come from density purchased by the developers for a new building on a portion of one of the parking lots. And the town of Chevy Chase has agreed to fund up to $4 million for this project. What is still needed is the necessary amount and the commitment to that amount from the county. However, no money was provided in the draft CIP. Instead, the county executive stated only his commitment to find the required funding. We appreciate the support that the county executive has shown, but we are keenly disappointed the CIP did not include even a placeholder amount for this project. It is vital that the county executive provide an amendment to the CIP that will set out the amount needed, and we ask the county council to urge the county executive to do so. This is the time to create these parks. Action not taken will probably result in this land being taken for more development. This opportunity, if not seized now, will never come back. Thank you for listening.
Thank you for your testimony. Our next speaker is Jane Lyons. Jane, you have 2 minutes for your testimony. You may begin when you're ready.
Thank you and good afternoon. My name is Jane Lyons and I'm speaking on behalf of the Coalition for Smarter Growth, the leading organization advocating for walkable, bikeable, inclusive, transit-oriented communities. We are extremely pleased by the level of funding for bus rapid transit in the county executive's recommended CIP and urge you to keep those appropriations. Montgomery County became a national inspiration when it approved an 81-mile BRT network nearly a decade ago in 2013. While it is now great to have the Flash along Route 29, implementation of the network is taking too long given the urgent need for better transit and access to jobs and fighting climate change. Funding and moving expeditiously through design to construction on Veers Mill and Maryland 355 Central BRT routes is critical to achieve transportation equity. These corridors provide essential connections to jobs, education, and more, and have some of the highest existing transit ridership and offer the greatest benefit from your investment. Furthermore, we urge you to support the $433 million included for Vision Zero and to further bolster the amount appropriated for pedestrian and bicycle facilities. We hope the prioritized projects will include a focus on street lighting, access to transit stations, safe routes to schools, and equity emphasis areas. We are dismayed to see that the Capitol Crescent Trail Tunnel has been stripped out of the CIP again. We urge that this high capacity and safety critical facility be added back. Other priorities for achieving more sustainable, inclusive communities include metro entrances, electrification of the ride-on fleet, and moving the bus depot to allow for a TOD at Shady Grove. We also urge you to increase the funding for affordable housing and parks and recreation and to keep school capacity projects on track. Please see our written testimony for our full comments. Thank you very much.
Thank you for your testimony. Our next speaker is Seth Grimes. Seth, you have 2 minutes for your testimony. You may begin when you're ready.
Thank you. Council President Albornoz and council members, I'm Seth Grimes. Recognizing that the CIP proposal covers a variety of worthy but competing spending priorities, I'll focus my comments on bus rapid transit and affordable housing. I support spending in both areas and regard only that the county executive has not proposed a greater amount for affordable housing. Beers Mill Road and MD 355 are priority BRT corridors. Beers Mill Road service will provide a much needed higher speed, roughly east-west transit option to a significant number of minority and lower income residents and riders. It'll connect housing and employment centers, reducing congestion, and particularly with bus electrification, the environmental impact of getting around Montgomery County, as well the 355 route. As a bus rider myself, and more important as an environmental and equity advocate, I support full CIP funding of these BRT routes. I'll add 2 points. 1, we won't have true bus rapid transit without dedicated bus lanes, which is not currently planned for 355. Also, this is not a capital point, but please keep ride-on fare free through the entirety of the network to better support riders who are struggling financially, to grow ridership, speed trips, and boost operator safety by eliminating fare collection. Affordable housing. $146 million sounds like a munificent sum. However, that's only $22 million each CIP a year for affordable housing acquisition and preservation. It's not a lot given Montgomery County's huge unmet need for housing of all types and especially affordable. Please see whether you can find additional funds for affordable housing without taking funds from schools, parks, or other investments, and complement our affordable housing support with zoning and land use reforms, not a capital point, but one that you should get moving on, to encourage property owner and developer creation of new housing without county capital investment. I urge you to bring Thrive 2050 to a vote and advance the zoning reforms that we all know are needed. Thank you for this opportunity to comment.
Thank you for your testimony. Our next speaker is Rosemary Wilson. Rosemary, you have 2 minutes for your testimony. You may begin when you're ready. You need to unmute your microphone. We still can't hear you.
We can see you, but we can't hear you.
Apologize for that. I actually was not ready to testify. I was not notified that I was going to be able to.
Would you like to provide your testimony now?
Sure. I don't have anything prepared because I was not notified. So I am the Sligo-Grandview Community Association president. In Sligo-Grandview is right in the Long Branch neighborhood. And we have seen a lot of effects with Purple Line coming in, and all that is changing in the Long Branch Business District, and with all of the needs with the Long Branch Community Center as well. So we want to continue to see funding as well as assistance pushed into the current Long Branch Community Center, as well as the library and the surrounding park area. And I know that Annie Tolkien will be speaking more towards this. So my apologies for not having anything more put together, but thank you for your time.
Thank you for your testimony. Our next speaker is Kathleen Meem. Kathleen, you have 2 minutes for your testimony, and you may begin when you're ready.
Okay, thank you for the opportunity to testify with you today. I'm testifying as an individual who works and lives in Montgomery County, and also on behalf of MOORE, or Mid-Atlantic Off-Road Enthusiasts, which is a mountain biking and trail advocacy organization that works closely with the County Parks Department to build and maintain natural surface trails in the county parks. I'm providing testimony to urge the council to restore the funding to the Parks Department. The county park system provides opportunities for outdoor recreation that are close to home and available to people to all ages and backgrounds. I personally use the park system all year round, particularly the natural surface trails, open space areas, and picnic areas. I'm well aware of the diversity of patrons that use these parks, including families and individuals looking for a respite from the daily grind. I can't stress enough the importance of the county park system in providing meaningful benefits to county residents, but also note that these benefits are difficult to measure. After all, how does one quantify the physical and mental health benefits enjoyed by residents in the park system? Yet these benefits, the benefits offered by a robust park system, don't stop with the individual residents, because a robust park system also creates a more attractive place to live, which in turn attracts businesses and residents alike to make Montgomery County their home, which contributes to the economic health and tax base for the county. The importance of the park system was especially apparent during the past couple of years in COVID world, when people flocked to the outdoor spaces and reconnected with the park system. And it was an invaluable resource throughout the county. I've lived in the county for over 6 decades, and I can assure you that the Parks Department has done an excellent job in making the parks available for people from all walks of life, and it's critical that they receive the funding to continue this very important work throughout the county. Thank you for your time.
Thank you for your testimony. Our next speaker is Lloyd Gressy. Lloyd, you have 2 minutes for your testimony, and you may begin when you're ready.
I'm Lloyd Gersey, appearing on behalf of the Citizens Coordinating Committee on Friendship Heights, an association of 20 communities in and around Friendship Heights. Our communities are infuriated by the county's failure to carry out its commitment to provide a park on a lot on Willard Avenue in Friendship Heights. 27 years ago, the county recognized that the very dense development authorized by the Friendship Heights sector plan required additional parks. The county said it would provide land as a necessary amenity. In 1995, the county bought, for conversion to park use, an acre of land adjoining the existing Willard Avenue Park. For 27 years, this acre has not been converted to parks use. It sits there surrounded by a chain link fence with a house that Parks rents to private people for their own personal benefit. Our repeated efforts to get Parks to convert the acre into park use have been denied with claims of no funds. Again, the proposed CIP before you has no funds specifically for this. The CIP has the Urban Parks Element Program, which has discretionary money that Parks could spend on this. However, Parks has said to us, no, none of this money will go to the conversion of that land to Parks use. We asked the council to insert language in the Urban Parks Elements Program that requires some of those funds to be used to convert the Willard Avenue acre into parks use. As we see it, this is a test case for the county's land use policy, emphasizing densification near metro stops and accompanying that more parks. So far, Parks and Plannings has failed the test abysmally. The council needs to demonstrate that density is serviced with parks. Thank you for your time.
Thank you for your testimony. Our next speaker is Juan Gonzalez. Juan will be providing his testimony in Spanish, and my colleague Marcela Rodriguez will be providing interpretation in English right after. Juan.
Señor González, buenas tardes. Este es un momento para dar su testimonio y cuando usted concluya yo voy a interpretar su testimonio.
Okay, can you hear me?
We can hear you.
Okay, sí, buenas tardes, honorables miembros del Consejo del Condado. Quiero agradecer la oportunidad que se me está brindando a testificar ante ustedes. Mi nombre es Juan González Cárdenas. Soy residente del condado de Montgomery desde 1995 hasta la fecha. Ahora estoy ante ustedes para pedirles que destinen más fondos para nuestra comunidad, especialmente en el sistema de seguridad. Poner más cámaras, más policías, más señales de tránsito para bienestar de los residentes del área, especialmente del área de Wheaton, donde se han realizado actos de vandalismo, robos y actos criminales, especialmente sobre la avenida Georgia y la estación de Wheaton, especialmente después de las 11 de la noche, cuando más residentes regresan de sus trabajos, especialmente de las personas que se dedican a la limpieza de edificios, de oficinas y trabajos de restaurantes. Ante esta situación, sugiero a ustedes que haya más vigilancia policial después de las 11 de la noche. Son las horas más vulnerables durante la noche. Y gracias por su tiempo y buenas tardes.
Good afternoon, honorable members of the County Council. First, I would like to thank you for the opportunity you have given me to testify before you. My name is Juan Gonzalez, and I have been a resident of this county for many years since 1995. I am here today to ask you to assign more funds for our security. In Wheaton, we need more police presence, especially in the most vulnerable areas due to the high numbers of crimes where acts of vandalism, thefts, and criminal acts occur the most. One of the areas of concern is Wheaton Metro Station and also Georgia Avenue, especially after 11 p.m. when many residents return from jobs, which include cleaning buildings or working at restaurants. Given this situation, I request more police presence, especially late at night. Thank you so much for your time.
Thank you, Marcela. Our next speaker is Todd Bauer. Todd, you have 2 minutes for your testimony, and you may begin when you are ready.
Hi, my name is Todd Bauer. I'm a resident of Germantown, Maryland, and also work within the county in Gaithersburg. I would like to also thank you all for this opportunity to testify.
We just lost your audio.
There we go. Yeah, somebody muted me. Sorry about that. Anyway, again, I'd like to thank you for this opportunity to speak before you all today. I'm speaking because I heard that the county executive wanted to reduce the budget to the parks by, I believe, 19 million for fiscal year 23-28. And I was a little upset to hear this, because if anybody has been to any of the parks over the last 2 years during the pandemic, they know that there's been an exponential growth in usership during the last 2 years. The parks provide every county resident, and not just county residents, but folks from out of the county, an opportunity to come and explore our trails, recreate, and of course, during the pandemic, just a bit of a stress reliever. So I'm asking you all to push back against the county executive's recommendations for a reduction in the budget to parks, because I think it would do a disservice to not only the residents, but also our guests that come in from out of the county and also out of the state to enjoy the parks, our natural surface trails, and the facilities within our county. So that's about it. So thank you very much for your time.
Thank you for your testimony. Our next speaker is Austin Stale. Austin, you have 2 minutes for your testimony. You may begin when you are ready.
Hello, can you hear me?
We can hear you.
Great. Can you see me too?
We can see you.
All right, thank you. My name is Austin Steele. I'm Executive Director of Trail Conservancy. And since 2008, our organization has provided natural surface trail services in Montgomery County and throughout Maryland, including obtaining grants for those trails, also in Montgomery County. Our organization was born out of the clear need for park trails that up to that time had extremely little funding, budget, or support. Then starting about 10 years ago, under the guidance of Chair Trail, of an experienced, skillful trail crews making great progress with trails. I've seen firsthand the answer to the question, if you build it, will they come? Yes, they do. Without trails, how can we enjoy the wonderful park, the beautiful park trails and nature that's out in the green spaces? And trails take us there. So it was with great disappointment that I find the county executive recommending a large reduction in the park capital budget request for fiscal year 23 to 28. I'd like to draw your attention to the final survey results of the Parks and Recreation Vision 2030 report for trails. They are consistent with the survey results from a similar survey in 2008. So on page 12 of that vision report, figure 7, the two top items that the residents find the most important are trails. That's natural surface trails and paved trails, almost a dead by 1% difference. So we can clearly see that the community wants trails as a high priority. So as you make your difficult funding decisions, please bear in mind that Montgomery County residents have already stated that trails are a top priority for their parks. Will Montgomery County honor that majority voice in placing trails as a priority? Now, I could go on and talk about trails all day long, but stop there. Thank you
for your testimony.
Thank you.
Our next speaker is Dan DeFonso. Dan, you have 2 minutes for your testimony, and you may begin when you are ready.
Thank you. Good afternoon, council members. My name is Dan DeFonso, and I'm a 20-year member of the Montgomery County Roadrunners Club, which proudly boasts more than 3,000 members. As a marathon runner, I've logged thousands of miles in our parks, taking advantage of our pristine roads and trails. I'm thankful and appreciative for them each and every day. I'm also a soccer referee and a member of both the Capital Area Soccer Referees Association and Metropolitan Washington Soccer Referees Association. As such, I've spent hundreds of hours refereeing soccer games on nearly every field in the county. And I've noticed the demand for these spaces continuing to grow, with games on weekends being played literally from dawn until dusk. I speak to you today in opposition to the proposed cuts to the Montgomery Parks Capital Improvements Program that were recommended last month. These cuts simply don't reflect the reality of the needs of our residents who rely on these parks for recreation, fitness, and gathering opportunities now more than ever. With usage up and demand for outdoor recreational facilities continuing to grow, this funding is critical. It just can't wait. While we applaud the council's efforts to make the Vision Zero campaign a signature program, there's more that can be done at a time when the parks are seeing higher and higher utilization each and every day. The Open Streets initiative has been wildly popular with runners, walkers, and cyclists. It's become something akin to a street festival on weekends. We as runners notice it, and we do appreciate the efforts. While this increased utilization is great and exactly what we want, it doesn't come without a price. Overcrowding, wear and tear, and services to support this increase in daily use are necessary to provide safe and accessible parks for all of us to enjoy. On behalf of the Montgomery County Roadrunners Club, I urge you to consider fully funding the projects in the Capital Improvements Program budget. Thank you for your consideration.
Thank you for your testimony. Our next speaker is Kirk Schinkel. Kirk, you have 2 minutes for your testimony. You may begin when you are ready.
Thanks. I appreciate the opportunity to testify before the council today in favor of restoring proposed reductions in the parks funding as part of the fiscal 23-2028 CIP budget. As a member of the Silver Spring community and a parent of 3, access to quality parks is a vital part of my family's well-being and a crucial component of the health of our community. For example, on paternity leave, I carried my daughter through Brookside Gardens every day for months. During the pandemic, rain or shine, my family walked from our Winding Orchard home to meet neighbors along those paths, the only time we saw many of them for more than a year. Now my children 10, 11, and 4 have their own favorite trees and secret spots throughout Brookside and Wheaton Regional. We play tennis in the bubble during winter. We host birthdays at the carousel in the summer. We swim in MLK. We bike on Rachel Carson. We meet our retired neighbors and our favorite volunteers and our children's schoolmates more in these spaces than almost any other. These parks are not a community adjacent. They are of the community, and they deserve our care, attention, and funding. Fully funded parks are also an opportunity for everyday citizens to engage with their government in a positive, productive manner. For example, during the pandemic, I took the sport of disc golf up. We all had our hobbies. But I'm forced to drive to College Park in Gaithersburg to play, along with dozens of Montgomery County residents who have now come together to assess the possibility of building a course here. That effort is ongoing, but parks planners and employees have been immeasurably helpful in exploring possible sites, funding options, partnership possibilities, and just generally being extraordinarily helpful as we pursue this project. They're professionals. They need our full support, including financial support via the CIP. At a time when local governments face difficult policy choices and sometimes confrontational interactions with the public, supporting fully funded, well-resourced parks remains both meaningful and necessary. Less access, fewer services, and limited expansion of parks programs will harm community building in meaningful ways at a time when county growth is accelerating, and these spaces will become more vital in coming years. Please restore full funding to our parks and reverse these proposed cuts. Thank you.
Thank you for your testimony. Our next speaker is Daniel Centeno. Daniel, you have 2 minutes for your testimony. You may begin when you are ready.
Hello, my name is Daniel Centeno. I'm a network builder and a soccer coach in the Long Branch and Wheaton area. I'm in constant contact with the community members in these 2 locations. And one of the main reasons, to avoid these cuts is the necessity for the community to use green spaces, which are soccer fields, basketball courts, anything that can allow the families to have time together. Shown throughout the pandemic, sports is a crucial gateway to avoid violence, crime, in any of the neighborhoods in the adjacent areas of Long Branch and Wheaton. Being able to offer programs that will benefit the county in the long term, creating example citizens that will want to engage in as part of the county, and also families have shown that their kids have the necessity to be able to do sports, and this cut would completely annihilate all those chances for the community to grow and be part of organized sports in the area of Montgomery County. As mentioned by previous peers in this conversation, the necessity for fields is crucial. If we cut them out, we're basically cutting out the opportunity for kids to be able to be outside and fight obesity, diabetes, and all these health issues that sometimes are neglected by the county. So please, this is the time to make change, and thank you so much for your time.
Thank you for your testimony. Our next speaker is Jennifer Trujillo. Jennifer, you have 2 minutes for your testimony, and you may begin when you are ready.
Hi, thank you so much for having me today and allowing me to testify. I'm going to make sure my mic is up. Okay. I am, like many other people that are here, testifying in regards to parks and the natural trail and the hard surface trails in our area. I'm Jennifer Trujillo. I'm a lifetime Montgomery County resident, homeowner, and worker in this county. Parks are an integral part of our lives. They offer time with kids, family, and yourself in nature. It allows you to walk, run, play, reflect, interact. For kids, and we've talked about organized sports and group sports, that they offer an activity and an outlet for so many. But for kids that don't participate or adults that don't participate in organized sports, they offer an active way to get outside and move. And for kids, it's an active way to learn group skills and a creative outlet for their energy and to be active. Parks also offer a safe, socially distant, and affordable place for people to meet up and to connect. They're not only close to home, but it also allows you to explore and connect in other areas and communities and ecosystems and environments in our county. It's affordable for all, and it allows for physical activities, social gatherings, and reflections. They offer places to try new things: climbing, skate parks, pump tracks, running trails, horseback riding, bike riding, all the athletic fields, all the amazing amenities that we're proud to have in our county, ice rinks, more and more. They offer, again, active and passive participation in our lives, and also ways to connect. In our current difficult times, and in any times, parks are more needed than ever. I personally rely on public transportation, cycling, and walking as my ways to get around. And I strongly care about those things, and a huge advocate in those worlds. I care about the Capitol Crescent Trail and the Bethesda Tunnel. I'm really distressed that we went through all this hoo-ha with the tunnel, and now it's a street workaround, and the tunnel, fund the tunnel. And also the Vision Zero plans for our region, and all of the park trail improvements and networks. We were really on track to be a stellar part of the country in having long.
I'm sorry to interrupt. Your time is up.
Okay, thank you.
Thank you for your testimony.
Yeah,
our next speaker is Valerie Salazar. Valerie, you have 2 minutes for your testimony, and you may begin when you are ready.
Oh, let me make sure. I thought it was 16. Can you guys hear me?
We can hear you.
Yes. Wonderful. Thank you, and good afternoon, everyone. My name is Valerie Salazar, and I am a community organizer with Impact Silver Spring. As an organizer, I am in constant contact with community members in the Aspen Hill area, more specifically Connecticut Avenue, Georgia Avenue, and Hewitt Avenue. And the common concerns that we hear among these residents is pedestrian and vehicle safety. Residents in Hewitt Avenue are in unceasing fear when it comes to accidents in their neighborhood. There's a consequence of the lack of speed control, which has now cost the life of 2 pedestrians in the past year. These avenues are densely populated by numerous apartment complexes, and there's a school at the end of the street. But regardless, there is very little signaling, there's no speed bumps or monitoring to assure safety. Also, the intersection of Connecticut Avenue and Georgia Avenue, the pedestrians crosswalk in place does not allow adequate timing for the amount of pedestrian traffic there is in that area. This causes folks to cross the 8-line very dangerous street, which creates accidents and puts both the drivers and the crossers at risk. So with that said, I ask the County Council, to the best of your ability, to please include in your budget these much needed measures and funding to protect and improve your resident safety and improve the existing irregularities, or to please give the needed instructions to the departments in charge of these problems. Thanks so much for your time.
Thank you for your testimony. Our next speaker is Christina Mysick. Christina, you have 2 minutes for your testimony. You may begin when you are ready.
My name is Christina Mysick. Today I represent Trot, or Trail Riders of Today, a membership-based association of equestrians who ride horses in natural surface trails, open spaces, and parkland through Maryland. One of our main interests is in protecting and preserving our parks. I moved to Montgomery County for 2 main reasons: our amazing agricultural reserve and our park system. Over the last 2 years of COVID, outdoor activities have become essential services, and the use of our parks simply blossomed as our citizens looked for ways to enjoy themselves outdoors. During COVID, our partners at DNR initially looked to limit access to the outdoors by specific user groups at the beginning of the pandemic by restricting equestrian use on all trails and parklands for months. Unfortunately, this created an atmosphere of perceived prejudice because equestrians often live adjacent to parkland, natural surface trails, so they might exercise their horses in the absence of large acreage or expensive indoor-outdoor arenas. In comparison to DNR, Montgomery County parks were kept open for all user groups, and the park department tried to do as much as possible to create new offerings that might fit with COVID guidelines to increase use and welcome as many as possible, i.e. the new Picnic in the Park program. Equestrians in Maryland will be forever grateful to the county parks that not only retained access as best they could, but also increased access for a variety of new user groups. The current proposal to cut the Montgomery County Parks budget by $19.4 million and the general obligation bonds by 16% is unconscionable when use numbers are at an all-time high and so many of our citizens consider our parks an important refuge. This reduction in spend is from the amount deemed by the park professionals as the minimum to adequately support our parks. Unfortunately, these cuts reflect a decreasing priority for our county parks at specifically the exact time when Trot believes the relative value of our parks to the quality of life of county residents is increasing exponentially, not decreasing. Regrettably, no park project is immune to fiscal cuts, considering the magnitude of this reduction. Our award-winning parks are essential for sustainable, livable, and healthy communities. Please act now to restore SIP funding for parks 23 to 28. Thank you.
Thank you for your testimony. Our next speaker is Michael English. Michael, you have 2 minutes for your testimony. You may begin when you are ready.
All right, thank you very much. Thank you for hearing my testimony. I understand that the creation of a budget is a complex process where there's no pleasing everyone, but it is also a values document. It's easy for county leadership to say something's important. It's another thing altogether to devote the resources necessary to make progress reality. This holds true for affordable housing funding as much as any other issue. I know that the proposal applies almost $150 million for affordable housing projects of one kind or another, and that is to be commended. But as you can see, oh, excuse me, I have to change my background from another event last night. But as you can see by looking around the county or by looking at the planning department's housing needs assessment, we need much more. I advocate for zoning reform and more market rate housing for a reason. I think they are both needed and they both help solve our housing crisis. Furthermore, we can't provide the affordable housing we need without major zoning reform. But people making less than the area median income, particularly those below 65, 50, or even 30% of it, need more than that. They need assistance, and we need to pay to make it happen. I'm glad that Thrive 2050, the proposed general plan for the county, calls for a significant expansion of affordable housing and affirms housing as a human right. We can only claim to live our values on that issue if we devote more funds to it. We need more affordable housing funding, yes, including raising taxes, yes, including raising my taxes, to help pay for it in the long term. I understand the county's hands are tied by the 3.2% cap on the local income tax until the state takes action to lift it, but there are alternative sources of income, including property taxes, an increase in the recordation tax, tax on turnover projects not previously subject to impact taxes, and others. I understand that not all of these are discussions within the technical scope of the CIP, but I think it is both related and important enough to raise in this forum. I'd also like to briefly call attention, as many others have, to the $19 million reduction in parks funding. I know how important parks have been to me and others to get through the last 2 years, and would urge the council to cast a wary eye towards a cut of this magnitude at any time, let alone when outdoor spaces for recreation have been more vital than ever. Again, none of these decisions are easy, but they are important, and when it comes to our housing crisis, people are being hurt every day. We don't make it a priority. Thank you.
Thank you for your testimony. Our next speaker is Melissa McKenna. Melissa, you have 2 minutes for your testimony. You may begin when you are ready.
Okay. Good afternoon. My name is Melissa McKenna. Today I'd like to talk about transit. Bet you didn't see that one coming. Having lived behind what is now downtown Crown, the Great Seneca Transit Network is a bus system to get around within the county, not just for commuting purposes. It will be more useful and flexible than light rail. By 2026, the new Crown High School will sit proudly at the corner of Fields Road and Omega Drive. That corner is not on any planned route, and it needs to be. I urge you to connect our students and their education with their future by making the small route change in my written testimony. CURS will always exist in Montgomery County, and the suburbs still require personal transportation. While I'm glad to see the Observation Drive extension included, a 3-year delay on a long overdue promise is not acceptable. Please accelerate this schedule. In the zero-sum game that is the CIP budget with constrained spending affordability guidelines, something will have to give to finance these projects. We can't just make the pie bigger with fiscal rebasing that appears to improve revenue projections in school impact taxes and recordation taxes. That's risky business. Speaking of risky business, the county executive's budget assumes that we will get roughly double the historic annual MCPS state aid allocation for the next 2 years and even more in FY 25 to 27. If those assumptions are wrong, think of the effect on communities expecting new schools. My greatest concern after the cost of MCPS projects is how facilities are being built. MCPS should only be planning and building net zero energy schools. Something incredible happened in March 2021, a record opening of 7 new schools, the last of the RevX series. How many of them had solar on the roof? 0. In the preliminary designs for Woodward and Crown High Schools, neither has solar included. You have many tools in your toolbox to insist that net zero energy schools are the only schools constructed. The time is now to use these tools to build schools of the future today. There is no planet B. Our children still only have one shot. I urge you to spend wisely. Thank you.
Thank you for your testimony. Our next speaker is Diana Conway. Diana, you have 2 minutes for your testimony. You may begin when you are ready.
Great, thank you. Hi, good afternoon, President Albornoz and members of the council. Thanks for taking this testimony. For the record, I'm Diana Conway, speaking on behalf of Safe, Healthy Playing Fields, a national 501c3 nonprofit. We help communities and policymakers facing decisions on plastic toxic fields versus safer, softer, cooler, cheaper grass fields. I'd like to start with parks. I'm also startled and dismayed at the cuts. In particular, the cuts to Brookside are a huge blow. It's one of the most frequented parks and one of the only truly handicapped accessible parks. Its central location makes it geographically appealing for all of the county. Second, the cuts to trail maintenance need to be reversed. Outdoor activity is set to increase with the spring, and leaving aside the actual importance of free physical exercise, the mental health role of these resources is beyond scientifically proven. They need to be available and safe. And third, when can I count on you to take action on synthetic turf fields? The volume of evidence of the defects inherent in these fields is only rising. Allowing even one more of these plastic disasters is intellectually incoherent for you in light of your many statements proclaiming your advanced thinking on climate change. There are 250 to 350 tons of hot, toxic, unsustainable petroleum waste, each killing 2 acres of soil at the cost of losing the carbon sink that supplied eco services and was a cooling net impact of the soil that was there before. You've heard me compare these fields to bad relationships. They're lethally hot, literally lethally hot. They're toxic to everyone around. The chemicals, the microplastics, the toxic runoff, the years of steady leachate, something for everyone. They're wildly expensive. They generate dramatically higher injury rates for joints, for concussions, for torque, like ACL or ankle, and for the notorious turf burn, which an MCPS student described to the Board of Ed as, quote, gashes, lacerations, and wounds, which is perfect for my bad relationship analogy. And finally, you can't get rid of them. For the third year, the multi-billion-dollar synthetic turf industry is fighting us in Annapolis on a straight.
Thank you for your testimony. Our next speaker is Sheldon Fishman. Sheldon, you have 2 minutes for your testimony, and you may begin when you are ready.
Thank you. My name is President Albornoz and Vice President Glass. Thank you, and members of the council. Thank you for the opportunity to address the council on the county's CIP budget. My name is Sheldon Fishman. We have lived in Montgomery County since 1974 and raised our 4 children here. We thank you for the funding for the public schools they attended and the sports fields they competed on and the public libraries and more. I have, including Sligo Creek right behind me. I have 4 requests that you'll see in my written testimony, but Diana Conway spoke most eloquently about synthetic turf fields, and I have very little to add. And the 6 people who asked you to restore the cuts in the Parks Department also addressed all the points better than I did on the benefits of parks. I guess I would just like to add 2 small comments then and end early, and because I'm the last speaker. And the 2 comments are that in addition to all the benefits the parks offer to the kids, the adults, and everybody in between, they also offer a real benefit to the environment. They are doing carbon sequestration, and we have a climate crisis. So restoring the funds for the Parks Department is an active step that you could do to implement the climate crisis initiative that you passed in 2019. And let me end with everybody's asked for more money, including me asking more money for parks. Let me just add with a way to save some money. If you put something into the capital improvement budget that said that nobody could spend money on synthetic turf fields and they had to use state-of-the-art grass fields instead, you would save $750,000 for every one of them.
Sheldon, I'm sorry to interrupt. Your time is up.
All right, thank you.
For your testimony. And that wraps up our speakers for this public hearing, Mr. Council President.
Thank you very much, Ms. Salou. We've received a lot of very thoughtful testimony this afternoon. I think given the significant percentage of people speaking to parks issues, I'd like to turn it over to our lead for parks on the council, Councilmember Friedson, just to say a couple of words.
Thank you, Mr. President. Just very briefly, we've gotten really important feedback from a lot of residents on a lot of important issues, particularly on parks, and just wanted to note that this council in the past several years has repeatedly restored a number of cuts to the Parks Department. I know we'll be taking a hard look this year again on it, and just know that we're committed to it and that we'll continue those efforts. And just really appreciate everybody weighing in and all of the thoughtful testimony provided here today.
Thank you very much, Councilmember Friedson. A lot of really great testimony over the last few days. So we look forward to the deliberations over the CIP. And with that, this public hearing is now closed. So thank you all very much. Have a wonderful afternoon.